Good morning. The Committee on Public Health and Human Services will come to order. I'd like to state that we have a quorum in the presence of Councilman Good, Councilman Denny O'Brien, Councilman Greenlee, the sponsor of this bill, and Councilman Kenyatta, and yours truly. We'd like to have the clerk read the bill.
Bill number 141026, enacting a new chapter 9-4100 of the Philadelphia Code entitled Promoting Healthy Families and Workplaces, provide that certain employees are entitled to paid and unpaid leave, all under certain terms and conditions.
Thank you. We welcome all of you here this morning to present your testimony on behalf of this this legislation that has been in the works for a long time, and we hope that you will try to limit your testimony. We have a long witness list, and respect the time of the witnesses and yourself who've come out today. And so I recognize Councilman Greenlee, who has done an awful lot of work in bringing this bill here at this point today, and ask him to make a few remarks.
Thank you, Madam Chair, and thank you for calling this hearing. I think it's fair to say we've heard many comments and opinions over the past many years on paid sick leave, and we'll hear more today. But when you get past all those words, all the analysis, all the comments, all the worst-case scenarios that we have heard, there's really only one basic question that's relevant, in my opinion. And that is, in 2015, in Philadelphia, should most workers have the right to earn 5 paid sick days to attend to the health needs of themselves and their families? 5 days. 5. This very modest regulation has worked across the country in many cities and some states, and the problems that have been predicted simply have not occurred. President Obama has included paid sick leave as a key agenda item for his administration. And in fact, the president's sick leave plan, in some ways, is stronger than the ones we're considering here today. And let me be clear on that matter. In a perfect world, this would not be the bill I'd be introducing. Ideally, I like to see more people covered, maybe get a day or two more leave a year. But over the last 8 years, we have tried to compromise on getting fair legislation, as fair as we could, even while many opponents were just saying no. We kept trying because we want to be business friendly, despite what our critics may say. But we also, and I think this should also be our priority, how about being worker friendly also? And I believe we can do both. I want to thank Mayor Nutter, Chief of Staff Gillison, who will be testifying in a minute, Bob Merkin from the Mayor's office for working together to put forth what we think is the best bill we can do today. I also want to acknowledge the work of the Mayor's task force on paid sick leave for all they did. And I certainly want to thank Mary Ann Bellasorti and all the advocates for their steadfast support over all these many years. And also, I have to mention my legislative director, Noelle Marconi, who has taken this up as, I think, her life's mission for the last number of years. So with all that, Madam Chair, in short, this bill is fair to all and should be passed, and I respectfully ask the committee, once the hearing is over, to move this bill out favorably with a rule suspension. Thank you, Madam Chair.
Thank you very much. We appreciate the hard work you put in this, Councilman, and your dedicated commitment to this issue. And I know it can be frustrating and hard. So you hung in there and you've done a good job.
Thank you. Thank you.
Are there any comments from other members of the committee before we begin? Okay, we will now call the Chief of Staff, Mr. Everett Gillison, to testify.
Good morning, Chairman Tasco, Councilman Greenlee, members of the committee, and other members of council. I am Everett Gillison, Chief of Staff for Mayor Michael Nutter. Thank you for the opportunity to appear before you today on behalf of the mayor and his administration and to express enthusiastic support for this bill as it is proposed to be amended by Councilman Greenlee. In short, I agree with the statement that the councilman just made.
Okay, thank you.
But let me first begin by acknowledging, for the record, the difficult and fraught history of the proposal before you this morning. The mayor and the administration, like the sponsor, Councilman Greenlee, other members of council, and indeed stakeholders throughout the city, all have the experience to know that mandatory paid sick leave is an issue that arouses strong opinions and heated emotions. But the cause of giving workers a modicum of security to care for themselves and their loved ones is just and worthy of the struggle. In the recent past, the city has, along with the rest of the nation and the world, faced a financial crisis and the worst economic contraction since the Great Depression. In Philadelphia, workers, businesses, city government, council, and the administration together, I might add, struggled to survive. As the prior debates over bringing mandatory paid sick leave to Philadelphia show, many, including the mayor and members of this council, did not believe the time had come to ask more of businesses still reeling from recession while enduring a slow recovery. But today there is cause for hope. As of last October, unemployment in Philadelphia was at its lowest rate since 2008. Construction projects are taking off. Development is strong. People are going back to work, and we have a fresh start in Harrisburg. Nevertheless, many struggles continue, especially among poorer residents and those in lower wage jobs. Indeed, even in boom times, workers in jobs without sick leave benefits face lost pay or even dismissal if they had to take time off to care for their own health, the health of a child or an elder, or to recover and rebuild in the face of domestic violence or sexual assault. It is against this more hopeful backdrop, still marred by the unmet needs of many workers, that the mayor convened the Task Force on Paid Sick Leave. The task force charge was to conduct a thorough and balanced review of the impact on both employers and employees of requiring paid sick leave in Philadelphia. The task force, co-chaired by Natalie Lekovich and Dan Kalista, represented a balanced set of experts and professionals from the worker, employer, and public health perspectives. On behalf of Mayor Nutter and the administration, I want to thank all task force members and staff, commending them for their work, and acknowledge their significant contribution in helping to shape the discussion, debate, and final bill and amendments before us today. They have done their work, and they have done it well. With policy and business expertise, earnest debate, and listening, the task force produced a single report reflecting real consensus. In many significant ways, the bill now before the committee is consistent with the recommendations of the task force. For instance, the accrual rate is 1 hour of sick leave for every 40 hours worked, which is essentially 5 days a year when working full-time. Leave may be used not just for the employee's own health needs, but to attend to family members or to deal with domestic violence, sexual assault, or stalking. Employees with existing policies that meet the bill's requirements will not be required to alter those policies, and labor and management alike remain free to work out their own paid sick leave benefits through collective bargaining. Mayor Nutter believes that the time for paid sick leave has come. It will be a boon to those who need it to take care of themselves, their children, and their families while holding down a job. It is a step forward for the health of Philadelphians, and the reasonable scope of the basic benefit should not be an undue burden to businesses. Nevertheless, one paid sick leave is in effect. It will be critical to closely evaluate the one-year report that the bill requires, to heed the feedback of both employees and employers, and to remain open to making whatever adjustments are warranted so that paid sick leave is a win-win for all stakeholders. I would like to thank Councilman Greenlee for engaging in earnest and productive discussions with the administration about the bill, and particularly with respect to amendments that will facilitate enforcement. More importantly, Councilman Greenlee is to be commended for his thoughtful and focused advocacy, and also his willingness to make adjustments and amendments, both to this bill and relative to prior bills. Mayor Nutter believes these changes will make the bill easier to implement stronger, and more effective. The mayor strongly believes that this bill and its proposed amendments are the best example of compromise, consensus building, and just plain good public policy. This bill and the surrounding efforts can be a model for how we all deal with highly controversial issues while moving Philadelphia forward. I thank you for the opportunity to testify before the committee today. I would be happy to address any questions from the committee. Before I do that, I want to note that the Department of Health has submitted a written statement regarding the public benefits of paid sick leave, and I respectfully ask that it be included in the record. I also respectfully request that the committee include in the record the task force report, which I have attached to my written testimony, and I thank you.
Thank you. We will do that as you request.
Thank you.
Are there any questions on behalf before we go to the question, let me recognize that Councilwoman Keona Sanchez is a member of the committee and has arrived.
That's good.
And
Councilman Nielsen? No.
and Councilman Nielsen came in during the testimony. Councilman Kenyatta?
Thank you very much, Madam Chair. I just want to publicly acknowledge the work of my colleague, Councilman Bill Greenlee, but also the Mayor of Philadelphia, Michael Nutter, for putting together the task force and working in partnership with Councilman Bill Greenlee to come up with a compromise that will be supportive of the business community, but also will be supportive of those who are most in need, which are the workers. And so I just want to publicly acknowledge that we do great work in the city of Philadelphia when there's a good working relationship between the second floor administration and members of city council. And so I just want to publicly acknowledge the work of our mayor and his team for working with Councilman Bill Greenlee to make this bill come to fruition. Thank you very much.
Thank you.
Thank you very much, Councilman. We recognize Councilman Greenlee.
Thank you, Madam Chair, and I appreciate Councilman Johnson's comments, and I certainly agree with him on the cooperation the administration has given. Mr. Gilson, you agree with what I said. I agree with everything you said, too. Okay? I want that noted for the record. And the amendments that you referred to will certainly be offered at the meeting. And just for the record, they working with Mr. Merkin and the rest of the administration on the enforcement issue. I think we worked out everything there. And I would say most of the other are more clarification amendments. Just make it clear what the intent of the bill is. It really doesn't change that much. So again, thank you. I know we met, and you were the first one that came up with and talked to me about the task force idea. I think it worked very well. And again, it's always better when we all work together. Thank you,
I agree.
sir.
Thank you.
Thank you, Madam Chair.
Thank you. And the testimony from the
Health Department?
Health Department will go along with your testimony. Thank
I
you
appreciate
very much. Councilwoman Sanchez?
Thank you. I just also wanted to kind of echo the words of this has been kind of a long journey here, and I do want to thank the administration for establishing the task force and allowing the kind of input. I think that always helps us get to better legislation, and want to personally acknowledge the hard work and the persistence of Councilman Greenlee. He worked very strongly on this and collaborated with all of us in council and meeting after meeting after meeting, and really tried to be as inclusive and as he possibly could. And so I just want to acknowledge that, you know, today is an important day, and us signaling that as a city, we recognize that prosperity for all is achievable, and that we recognize that our huge poverty rate in the city is one that we have to tackle together with deliberate policy that sends a message about accountability, but also the fact that we appreciate low-wage workers in the city. When I think about that woman who has to make a decision whether she stays home with her child, who is sick or goes to work, and what that means, I think it's a tremendous step in the right direction. So I want to publicly acknowledge the mayor, who, like business tax reform, started in one place and listened, and we ended up in a better place for everyone. So thank you very much. Thank you, and congratulations to Councilman Greenlee.
Ellen Bravo, Jessica Millie. We would appreciate it if you will limit your testimony to 3 minutes. We have 8 panels, and that would help a lot. All right, Ms. Lewitt.
Okay, thank you. Good afternoon. Thank you so much. I want to thank Councilmember Greenlee for all of his work on this bill, and thank you to the council members for inviting us to testify. My name is Sherry Lewan. I am co-president of A Better Balance, which is a national legal advocacy organization that's been writing paid sick days laws around the country. And we've been working with advocates and legislators here in Philadelphia as well. When this process began here in Philadelphia in 2008, only San Francisco had passed paid sick days law. Now there are 3 states and 16 localities that require businesses to provide a minimal amount of paid sick time to their workers. My testimony, which you have in writing, and I will condense because I respect the 3-minute warning
Excuse me,
here.
let me interrupt you for a moment.
Yeah, sure.
All of the testimony presented will be a part of the record, so you don't necessarily have to read the entire testimony because the entire presentation will be a part of the public record.
Thank you. So I just wanted to make the point very strongly that this law is very similar in structure and content to the laws that have been passed around the country and that have been successfully implemented. There have been very few complaints filed in the jurisdictions where these laws have been passed, and there have been no complaints about negative impact on business or on the economy. And so I refer you to my testimony. For your convenience, there's an attachment that has a list of all the laws. And since I sent the testimony in last week, another city has passed paid sick days, Tacoma, Washington. So there will be many, many more in the months to come as we're working on those proposals. And as has been noted, the president has called on states and localities to pass paid sick time as well. I just wanted to emphasize, because there has been a lot of talk about a carve-out for smaller businesses and the size of that carve-out, and we are now at 10. The prior proposals had 5. That carve-out is the largest of any municipalities that have enacted this law, and so I would really urge the council and not to enlarge that carve-out any more than 10. Everyone needs paid sick time. And the principles behind paid sick time, which you all know and I know you support, are not any different from workers in smaller than in larger businesses. As to the carve-out for under 10, we really applaud you for adding at least unpaid sick time protection, and we hope that will stay in the bill so that people can't be fired for taking paid sick time. So yeah, and there are provisions in this bill that do support business and will make it easier for them to implement this, and I just want to focus on those as well. I think it's a great balance between the needs of workers and the needs of business. I think it's an excellent bill. I did a brief survey of some of the cities where paid sick time has been implemented. San Francisco, for example, which has been in effect since 2007, only has had 400 complaints in all of that time. I know that there is some concern by the administration about enforcement, but it has not been a problem in San Francisco. It has not been a problem in Seattle, where there have been about 100 complaints since passage a year and a half ago. So in closing, this bill provides an excellent solution to the problem of the lack of paid sick time for 40% of the Philadelphia workforce. It's worked in other jurisdictions throughout the country. It considers the needs of both workers and employers, and we hope that the bill will be enacted and signed into law very soon. Thank you so much.
Thank you very much.
Thank you.
Let me recognize Councilwoman Cindy.
Oh, sorry, go ahead.
And Councilman Curtis Jones is in his seat. Thank you.
Okay. My name is Ellen Bravo. That's B as in beneficial, R reasonable, A advantageous, V vital, and O overdue. Really proud to be here. I help lead a network called Family Values at Work, 21 coalitions in 21 states that include the 16 cities and 3 states that have helped more than 9.5 million people be able to earn paid sick days. And I feel like I'm coming back from the future, this is that year, to bring you good news, because we know what it looks like and what your city will look like. So, for example, we had a number of members who wrote letters to the president asking him to make the very statement of support that he did in the State of the Union. One of them is a seamstress in Portland, her name Erin, and she talked about waking up one morning aching so badly she literally didn't know how to get up without help. And she said, I had a few minutes of panic and anxiety, and then I remembered that we won paid sick days, and I could take care of myself and still feed my kids. So we need to remember that's what paid sick days means, that you don't get docked your pay or risk your job for being a good parent or following doctor's orders. That's good news number one. Good news number two is these bills have been in effect long enough in a number of places that there's a growing body of evidence that has completely shredded the predictions of doom and that has lots of quantitative data, and you'll hear some more of this from Jessica Milley in a moment. I just want to remind you that the chief lobbyist of the Golden Gate Restaurant Association in San Francisco, several years after the bill actually went into effect, told a business reporter, you know what, it's the best public policy for the least cost. After all, you don't want your server coughing over your food. Good news number three, every one of our coalitions has business partners. And here's what they tell us, and you'll hear from some of your own business leaders on this issue. We already do it because it's the smart as well as the right thing to do, but we want there to be a minimum standard for everyone to do it because other people's workers are our customers. And if they lose a paycheck or a job because they were sick or they were caring for a sick loved one like we tell them to do, then they don't come to my auto repair shop or my deli or buy my shoes. It's good for the economy and good for businesses to do this. Here's another good news, as Sherry Lewin pointed out, these are not difficult to administer. So Donna Levitt is the name of the administrator in San Francisco. She came to testify in Connecticut, and she said to them, and I'm going to quote, since the law took effect, that was in 2007, we've heard relatively few problems. I'm not aware of any employer in San Francisco who has reduced staff or made any other significant change in their business as a result of the sick leave ordinance. And finally, I want to remind you how voters feel about this. It's wildly popular across all political demarcations, all demographics. It's a really urgently needed and huge help. Thank you for reminding us, Councilmember Sanchez, about the importance of low-wage workers and the need, as your task force pointed out, that paid sick days is a measure of job security and income stability. We applaud you for becoming what will soon be the 17th city. We especially want to applaud Councilmember Greenlee, Marianne Bellasorte, and the Earned Sick Time Coalition. We can't wait to celebrate with you. Thank you so much.
Thank you. Thank you so much. That's very important to share what's happening nationally and the result of the action taken in other cities across the country. We appreciate you taking your time to come here to share that with us. Ms. Milley?
Thank you for the opportunity to address the question of how a paid sick days policy would impact the Philadelphia community. My name is Jessica Milley. I'm a senior research associate at the Institute for Women's Policy Research in Washington, D.C. IWPR conducts data analysis and disseminates its findings to inform policy, address the needs of women, strengthen families, communities, and societies. And as part of this mission, IWPR has been conducting estimates of the costs and benefits of paid sick days for over a decade. In Philadelphia specifically, IWPR released 2 reports in early 2013 documenting both the costs and benefits of a previously proposed paid sick days law. We estimated that the cost to employers would be approximately 25 cents per hour to cover workers who currently lack paid sick days. And these estimates are in agreement with national data from the Bureau of Labor Statistics that estimate that the average cost of providing paid leave in 2014 to be only 34 cents per hour. Costs are even lower in some occupational categories, particularly in those who have very few workers currently covered by paid sick days policies. For example, 14 cents per hour in service occupations. As a proportion of wages, the cost of providing paid sick days amounts to about 1.5% of a worker's hourly wage, which is approximately equal to the cost of living adjustment in 2015. Many times, estimates of how much it will cost to provide this benefit to workers are much larger than those that IWPR calculates. Though the reasons behind these large estimated costs vary from source to source, they are often based on mistaken assumptions. The most common of these is that every employee covered will take every single sick day that is available to them. And data from the National Health Interview Survey prove otherwise, suggesting that the average use of sick days is only about 2.3 days per year, and many workers do not even take a single day off in a given year for illness. The monetary benefits of paid sick days policies are less straightforward to quantify, but IWPR has estimated that a paid sick days policy will result in a significant net savings in the Philadelphia community. Employers are projected to see the cost of implementing paid sick days defrayed by a reduction in costs associated with employee turnover. Preventing workplace contagion of communicable diseases will save employers millions of additional dollars. Contagion prevention will also save millions in health expenditures by families, insurers, and public agencies, while also improving the quality of life for residents of Philadelphia. Overall, we estimate a net savings of $24.8 million per year, and about $600,000 of which represents a savings to employers. For more details on our methodology and findings, I refer you to IWPR's 2 reports on paid sick days in Philadelphia from 2013, which are available on our website, www.iwpr.org. And I welcome any questions regarding the costs and benefits of implementing a paid sick days policy in Philadelphia, as well as questions on paid sick days policies in general. Thank you.
Thank you very much. Questions from members of the council? Thank you for your information taken. Thank you for coming to share with us the information from other places and the documentation you've presented. Thank you. Thank you. Our next panel is Ms. Natalie Lefkowitz and Amal Bass.
Good morning.
Good morning.
I'm very excited to testify in support of paid sick leave legislation today, and thank you for this opportunity. Having co-chaired the Mayor's Task Force on Paid Sick Leave, I've had the opportunity to carefully review, debate, and consider the implications of the policy both in the context of Philadelphia and other jurisdictions that have passed similar legislation. In the course of the task force deliberations, there were very diverse opinions represented. And what we accomplished and what we reached in our final report was a compromise position. So while I endorse the process and largely support the recommendations of the task force, I would like to share with you today the views that I personally bring to this question. I'm an employer, a public health professional, and a lifelong concerned citizen of this city. Wearing those hats, I firmly believe that we need a minimum paid sick leave mandate in Philadelphia. It is a matter of health, economic stability, and fairness. In reviewing the proposed bill, I find that it aligns well with the intent of the task force report, as well as most of its recommendations, is consistent with the standards contained in the ordinances of cities that have preceded us in enacting paid sick leave policies, and when compared with the bill that was approved by Council in 2013, represents a further compromise in a number of its provisions. This bill has been 7 years in the making. Given the time, money, and effort spent on the debate regarding this modest, though essential benefit, it would seem that the time to enact paid sick leave for Philadelphia workers is overdue. Therefore, I fully support passage of the ordinance and endorse without reservation its provisions. As an employer, I'm committed to offering generous paid sick leave because it contributes to a culture of health within my organization and to employee satisfaction, loyalty, and productivity. By making employees feel valued, we protect our investment in our workforce and model the care that we expect them to offer to our clients. Furthermore, we consider this to be a positive investment in the economy, in our quality of life, and in our sense of shared opportunity and fairness. As our economy has steadily improved since the recession, income inequality has grown and poverty in Philadelphia has remained steady. So, we have not all enjoyed the benefits of economic recovery. Can this be good or healthy for any of us? Is this a scenario in which we can feel safe and morally justified? Is this something of which we can be proud as we promote Philadelphia as a world-class city and as a desirable place to live, learn, work, and play? I do not believe that our prosperity hangs on denying basic benefits enjoyed by the majority to so many of our most vulnerable citizens, and that the hardships borne by the least advantaged among us is the reasonable or necessary price of a healthy economy. Low-income workers, people of color, and women are disproportionately affected by the absence of a paid sick leave mandate. Those who lack paid sick leave are forced to make impossible decisions that when they or their dependents are sick, to take time off for recovery or to jeopardize their family's financial needs. In some cases, to take time off may even lead to losing their job altogether. Would any of us want to make that choice when we or a spouse or a child is sick? I'm going to condense this. You have it in front of you in the interest of time. But I would be remiss if, as a public health professional, if I didn't point out that there's overwhelming consensus from scientists and public health experts representing the academic, government, research, and policy sectors that the absence of paid sick leave increases the risk to the public health through increased incidence of contagion. Similarly, there's little question that the absence of paid sick leave leads to poorer health and more expensive care for individuals and families. When people can't access preventive health services or timely treatment of illness, including rest, their health conditions become more serious or take longer to resolve, and the care they eventually need is likely to be more extensive and expensive. In other words, the impact of health is the exact opposite of what we all want: a healthier population and reduced health care costs. These are some of the issues that I ask you to consider in casting your vote for Bill 14102-600. Thank you.
Thank you so much for your testimony. Ms. Bass.
Good afternoon. My name is Amal Bass. I'm a staff attorney at the Women's Law Project, a nonprofit legal advocacy organization based in Philadelphia that advances the rights of women. Thank you to sponsors of this bill and also to the committee for giving us an opportunity to comment on the need for a city ordinance establishing paid sick leave. I will keep my remarks brief today, but we have submitted a more detailed written testimony that you should already have. Today, many working women are forced to shoulder a disproportionate share of child care and elder care at home without access to job-protected leave. Currently, the federal Family Medical Leave Act, FMLA, provides up to 12 weeks of leave to some employees to address serious medical needs, but it is unpaid, and many employees do not meet the FMLA's requirements. Workers without access to paid leave are forced to go to work when they are sick or when a family member needs care because they cannot lose a day of pay and they cannot risk losing their jobs. The lack of paid sick leave has dire health consequences for employees, their families, and the public. Working while sick delays recovery time and delays access to health care. It increases visits to the emergency room as well, adding to health care costs overall. It harms children who have longer recovery times and have fewer well or sick visits when their parents don't have leave. And it encourages the spread of contagious diseases like the flu. As the bill's findings highlight, CDC guidelines recommend that people experiencing the flu avoid public contact for a few days. But workers cannot abide by these recommendations and protect the health of their co-workers and the public without access to paid sick leave. Reducing the spread of illness to co-workers is just one of the ways earned paid sick leave benefits employers. Some studies estimate that sick employees are only half as productive at work. Family-friendly policies like paid sick leave also enhance employee retention and morale, resulting in higher levels of job satisfaction and higher levels of engagement, making these policies good for business. Speaking about the bill specifically, there are a few features I would like to highlight. First, while the Women's Law Project would have preferred a lower employer threshold size, we commend the requirement that employees who are otherwise unable to receive earned paid sick leave under this chapter will receive unpaid leave. Second, we also commend the inclusion of part-time workers who are often excluded from protection under the FMLA. Third, we appreciate the inclusive and realistic definition of family members for whom an employee may take paid leave. And fourth, we appreciate the provision of paid leave for reasons related to domestic and sexual violence. Currently, victims in Philadelphia have the right to take unpaid leave, but availability of paid leave better enables them to take the steps necessary to escape violence. We strongly support this bill, though we do wish it went farther to protect more people, such as adjunct faculty members, many of whom are women who are less likely than their male peers to receive tenure. Many of these academics live below the poverty line, and we worry that excluding them from protections of this ordinance may further marginalize them. Overall, however, we believe that the time has come for the City of Philadelphia to adopt paid leave legislation. It would protect the health of women and their families, address public health concerns, and promote efficiency and stability for the city's businesses. Thank you again for the opportunity to present this testimony.
Thank you for your testimony, Councilman.
Yeah, thank you, Madam Chair. Real quick, I know we got a lot of people testifying here. Thank you both for your testimony and all the work you've done. Ms. Lefkovich, Natalie, thank you as the co-chair of the task force. Just had one, I guess, just wanted to define an issue you talked about here. You said that this is the report was really a compromise. And I particularly want to mention the whole issue of the carve-out. And as I said in my open statement, I agree with Ms. Bass. I'd like it to be lower too, but legislation is what it is. But there were members of the task force that wanted it as high as 50. Is that not right?
That is correct.
Okay.
There were members who wanted no carve-out or a carve-out of 5, as in your original legislation, and others who wanted 50, and there were various compromise points in between. We negotiated and landed on 15.
And it is true, as you stated, that the vast majority of the bill is consistent with the task force recommendation. Right?
Absolutely.
Okay, and again, I know that it was a lot of work. And,
yes, it was.
For all that high pay you got, which was nothing. So I appreciate everything you did and the work of the whole task force. And Ms. Bass, I know we've talked before, and I appreciate all that Women's Law Project does. And I take I understand your comments. I wish it was a little stronger too, but we are where we are. So thank you. Thank you both. Thank you, Madam Chair.
Thank you, and let me say that when we pass legislation in this council, it's not the end. We can always review it, we can always amend it. So as we work through and see how this works in the city of Philadelphia, you may want to tweak it again later on down the line, and that is your right and privilege as a citizen, and it's the responsibility of the council to listen. So we are, and they will be open, I won't be here, to certainly review this piece of legislation, which is so important and serious that it's never set in stone. You can always come back and review it and amend.
Thank you.
Thank you. Thank you very much, both of you, for your testimony. Next, we have Ms. Fatima Hassan, Khalid Pitts, Jason McCarthy. Good morning.
Good morning. Good morning.
Ms. Fatima Hassan.
Yes, I'm Fatima Hassan. And I'd like to say good afternoon
You
and
have to speak into the mic so we can hear you. We have old ears.
good afternoon, Philadelphia City Council person, Marion Tasco, Vice Chair Maria Sinquez, am I saying it correctly? I'm sorry. And Kenyatta Johnson, who just stepped off, and Dennis O'Brien, Cindy Bass, and Ed Nilsson. I'm happy to be here this afternoon.
You have to
testifying.
speak into the microphone. Pull it up closer.
Okay.
Pull it up so we can
Can you hear me better?
We can't hear you.
Can you hear me now?
No, we can hear you now.
Can you hear me? I'm happy to be here this afternoon testifying on behalf of the Earned Sick Days. My name's Fatima Hassan, and I'm the owner and director of Places and Spaces for Growth Learning Center, which is a daycare center located in the Overbrook Farm section of Philadelphia. I have been in business for 17 years, and Places and Spaces is licensed for 26 children. I have a small child care center. However, we have 4 full-time teachers and 1 part-time lunch assistant. My center proudly participates in the Keystone Star program, and we have a 3-star rating. As an advocate for early child education, I have been working diligently to have the community respect the work we do and support the families we serve. I'm a member of DeVacy, which is the Delaware Association of the Education of Young Children. I've participated as a member of the former Child Space CDI, and where I've learned the value of what I do. I have participated an Action Day in Harrisburg, visiting my legislators and discussing the importance of child care and how it affects our community and the families we serve. I've also have been involved with the Southeastern Pennsylvania Early Childhood Coalition meetings to share in discussions about the state budget and how it affects our businesses. I share and care about my profession, so I care about the people I employ. Early child education has changed and developed over the last 10 years. With Philadelphia having over 7,000 child care facilities, our voices in the field of education and economic growth has expanded. We're moving past being considered glorified babysitters with little or no education. Child care providers are going back to school, educating themselves about the development of children, and for that, they should be compensated. We are providing a service that deserves to be compensated with job security. This is why passing this bill is important to me and all who share in our growth. So I offer earned sick pay to my employees. It just makes sense to do it. Understanding the importance of caring for children and for ourselves to make it too costly not to pay for sick leave. To keep down the spread of colds, flu, and other common illnesses we at Places and Spaces have a policy in place that require children to stay home until they are no longer contagious. This will keep them from spreading germs and to the other children and staff from getting sick. Because the chance of catching colds is part of what staff have to endure on a daily basis. If a child gets sick or if they have a loved one that they have to care for, it would be a disservice to my staff if I did not advise them to do the same. It would be more of a disservice not to pay them for missed days. I believe that treating and respecting my staff in a professional manner will in turn keep them regarding their work as important, as well as retaining the same staff for a longer period of time. When staff is consistent, children and parents benefit. Therefore, your child care center benefits. In the field of early child education, we still have a long way to go by compensating staff more for the work that they do, offering vacation days, personal paid time off, as well as providing retirement plans. After all, we are developing and educating, nurturing our future teachers, doctors, lawyers, politicians, artists, and chefs, etc. Promoting a healthy workplace by offering paid sick leave is just a start, but it's an important start. So please vote yes to earn sick leave, advocating for the importance of education during the early years and for the respect and acknowledgement of the professionals in the field should be a community effort. By saying yes to this bill will show not only child care professionals but all Philadelphian workers that they are valued. Thank you very much for giving me this opportunity to speak about such an important matter.
Thank you very much. Mr. Khalid Pitt.
Hi, thank you. I'd like to thank Chairwoman Tasco, Vice Chairman Sanchez, and the Committee on Public Health and Human Services for allowing me the opportunity to share my experiences with paid sick days. My name is Khalid Pitts. That's K-H-A-L-I-D as in distinctive, P-I-T-T-S as in Paul. I am a co-owner of Cork Wine Bar and Cork Market in our nation's capital, Washington, D.C. As a public health advocate, I have a master's in public health, and I am on the executive board of the Washington, D.C.'s State Health Exchange. I understand the impact of policies that promote the health of families can have on the welfare of the general public. As a business owner, I not only understand the responsibility I have in promoting the health and well-being of my employees, but I also see the dividends a healthy workforce has on my business. I have firsthand seen that paid sick days are not just the right thing to do for my employees, but the right thing to do for my bottom line. In 2008, Washington, D.C. became the second city to pass a paid sick days law, guaranteeing workers the ability to earn up to 7 paid sick days each year that can be used to recover from illness, care for sick family members, or seek preventative medical care or respond to domestic violence. And in 2014, the law was actually expanded to include tip workers, like those in my wine bar, and workers in their first year on a job. At Cork, my businesses, we have provided paid sick days since 2007, before the law was enacted in Washington, D.C. And we have not seen any negative effects that detractors and perhaps paid lobbyists claim would come. Some of those claims you actually might hear today. In fact, providing paid sick days has only helped my business. My market is a small specialty food store that sells wine. Within a 4-block radius, I have a Whole Foods and a Trader Joe's that compete directly with my business, directly for business and for employees. I don't have the economies of scale of those two businesses with the ability to offer an array of benefits. But one benefit that keeps me on equal footing with these two businesses, larger businesses, when competing for sales clerks or someone working in the kitchen, is that I can offer paid sick days. It goes without saying that a sick employee with, say, a strong cold or the flu is less productive than a healthy one. And I certainly can't afford to have my employees be anything less than their most productive if an evening service is going to run smoothly. I've had bartenders who have wanted to work when sick, but truth be told, because they are sick, they're less attentive, less responsive, and the guest feels less served, resulting in a shorter stay, i.e. a smaller paycheck and perhaps an unwillingness to return, and most likely less tip for that bartender, neither of which is a benefit for my business, that worker, and frankly the guest himself. And from a public health standpoint, when one of my employees is sick, the last thing I want is for them to be handling food. That'll only risk getting other employees and my customers sick. Now, I don't have an MBA, but getting your patron sick is not a good business model to follow. Thank you, Richard. Yet I also know my employees are trying to earn a living, and the idea of missing out on wages from even a single shift could throw off their budget entirely and could take months to recover from. No worker should worry about losing their job when they get sick, but that's the reality many Philadelphia workers face right now. And having to replace a worker for any reason is a cost in the business. Searching for new employees, training them, and possibly paying overtime for other workers to cover shifts. These costs add up, and margins are thin, particularly for small business owners. It has helped my business that other businesses, in my community pay a decent wage and provide paid sick days, because that means more money in workers' pockets, and they use that shopping and dining in the community, which means more revenue for my business and a larger tax base for the city. Finally, there are intangible benefits of providing paid sick days. As you heard earlier, employee satisfaction is higher, netting better customer service and a stronger employee loyalty. Employee retention is extremely important to any business, and I said before, particularly small businesses. My employees know we care about them. We want to make sure they're able to make a decent wage and don't have to worry about falling behind on bills if they get sick. Because of that, they are loyal and more dedicated, and we have much lower turnover costs. Paid sick days is not just good for workers and the public health, it's good for business and it's good for the economy. I encourage the council to follow the lead of Washington, D.C. and other cities across and states across the country and pass a paid sick days law. Thank you very much.
Thank you. Thank you very much.
Thank you.
Next, Mr. McCarthy.
Hello, everyone. I appreciate the opportunity, the chance to speak on behalf of restaurant workers in the city. My name is Jason McCarthy. I've worked in the restaurant industry in Philadelphia for 23 years now, and I've never had a paid sick day, regardless of how sick or injured I was. I've worked as a dishwasher, a cook, a server, bartender, you name it. I'm constantly exposed to staff and guests, and they're exposed to me. Most of my work entails handling other people's used plates and flatware, used glasses and napkins, water pitchers, and lots of little things like pens, the phone, soda guns, money that can easily spread germs. But plus all the sneezing and coughing that comes into play when you work in a public industry. It's enough to make a germaphobe cringe just a little bit. I can't imagine any rational person being comfortable knowing that their food and drinks are being prepared and served by someone sick or contagious. But restaurant workers can never consider a sore throat, the sniffles, the flu, or a stomach ailment a reason to call in sick. We don't get paid if we call in sick, so we go to work no matter how terrible we feel. This is due largely to the fact that restaurant owners and management will not accept any excuse for calling out. More than likely, they will require us to provide proof of illness, such as a note from a doctor to authenticate our injury or illness. This is ironic since most restaurant workers receive no health coverage whatsoever. We face retaliation or termination if anything goes wrong with us physically. So it's no mystery that even when we're contagious or in pain, we come to work. Not just because we need the day's pay, but we fear getting fired. In the tightly knit restaurant staff, we have to look out for one another. If something's wrong, we can't make it to work, we take it upon ourselves to get the shifts covered. We have to be cooperative and flexible with one another because management is prone to act as though calling out sick is some kind of personal attack, that being too sick to work is somehow lazy, disrespectful, and selfish. Personally, I've seen two people fired for calling out sick. One of my friends was out for 2 days with terrible back pain. Even after offering proof from her doctor, she was taken off the schedule and never heard from management again. Another friend the same year was fired within 20 minutes the first time she ever called out sick. There's a sick worker in nearly every restaurant in this city every day, but there's really no choice for us in the matter. We simply aren't allowed time to rest and heal the way so many other workers are. Personally, as your server or bartender, earning $2.83 an hour in Pennsylvania, I have worked through colds, the flu, sunburn, fever, strep throat, a broken rib, a broken foot, burns, cuts, even diarrhea. It saddens me that most restaurant and food service employees have no access to many of the benefits offered to many other Americans by their employers, such as state, city, and other white-collar workers. For us, who serve the public daily, there are no paid vacations. There is no pension, no paid holidays or bereavement, no health or dental coverage of any kind, and certainly never a paid sick day, ever. Philadelphia is a world-class city. We invite and welcome tourists, students, and dignitaries from all over the country and all over the world. As a hospitality professional, I welcome the opportunity to impress everyone who lives and visits here with all this city has to offer. Philadelphia can boast some of the best restaurants and service professionals available in the region. It's a vibrant, beautiful, historic American city. It's the birthplace of the nation, the first capital in a new country based on democracy. But to date, Pennsylvania and Philadelphia have yet to impress me on this issue. It seems restaurant workers, along with others in customer service and retail, don't deserve the same quality of life and employment that's enjoyed by other workers that benefit from contracts, unions, or greater political prowess. Most of the people I've worked with are intelligent, capable contributors to Philadelphia's thriving restaurant industry. We work hard, we enjoy what we do, and the people we work with. I don't understand why we should be penalized or punished for our chosen profession with sub-minimum wages and no chances of any benefits whatsoever. I'm willing to bet that if any of you felt lightheaded or feverish, if any of you felt nauseous or were hurt, that you would feel justified calling out sick without fear of retaliation. Unfortunately, if this bill isn't passed, employees in restaurants, retail, and fast food will have no choice but to come to work sick. We won't be allowed time to recover from a sudden illness or an unexpected injury without the fear of losing our job. So I'm speaking here today to ask for your help, to defend us, to stand up for those who seem too low to be extended the most simple common sense principle. If you're sick or hurt, take the day off. Many of us in the industry are so selfless that we can't put our needs above those of our employer or our guests. Others are too busy fighting to keep their spot to keep us on the lowest rung of the employer ladder. You have the ability to help change this. By including restaurant workers in this bill, you're demonstrating the democratic principles upon which our city and country were founded. So please allow us the right to stay home with the flu instead of spreading it to customers and everyone else in the workplace. Just grant us the right to be sick without fear of losing our pay or our job. I appreciate your attention and hope I've helped you to realize that there is a significant population here in this city that has been ignored when it comes to fair wages and quality in the workplace. Thank you for your time this afternoon.
Thank you very much, Councilman Greenlee.
Thank you, Madam Chair. I'd like to say, obviously, everybody that has already testified and is going to testify is important. I think these three people might be the most important people as far as defining why we need this law. Ms. Hassan and Mr. Pitts have proven, despite what a lot of businesses say, that sick leave not only can work, it's best for the business, and it has shown that. And as far as Mr. McCarthy goes, his story, trust me, we could fill this room and fill the hallways with people who could line up and tell similar stories as he does. In the interest of time, I urge people not to do that, okay?
Tell them to stay home.
Yeah, we tell them to stay home, especially if they don't feel well. But again, I just wanted to, and just one thing, and Ms. Hassan or Mr. Pitts, you could answer this. I know sometimes people sort of poo-poo the issue of if you give workers proper benefits, that they'll work harder, and by working harder, they'll feel better about their job, all that kind. Have you, given that you give these benefits, do you see that that's a fair, that that's not some kind of happy talk, that actually means something?
No, it's not happy talk. It actually means something. My place of business has been open on 8 years. The average employee retention is about 6 years. That's really unheard of, particularly with servers in the restaurant community, with people moving around to better other restaurants. But we provide both paid sick days and actually health care as well in my businesses.
Yeah. Mr. McCarthy, are you going to move to D.C. to work for Mr. Pitts?
I was thinking about it.
I was going to ask him. Actually, I was going to ask him.
He's already working on that? Okay. All right. Okay. Thank you, ma'am. Thank all three of you. Thank you very
Mr.
much.
Pitts, wait a minute, I have a couple of questions. How long did it take D.C. to pass their legislation?
In various forms, it's about as long as you have as well. Various iterations, trying to reach a compromise which was best for the city, for businesses, and for employees. And then much like you alluded to earlier, once it was passed in Washington, D.C., the City Council went back and looked at it and to see how it was affected and expanded the law.
Okay, thank you. Now, Ms. Hassan, being a small business owner, daycare, and having your employees available to the children when they come in, what impact has your sick leave policy had on your budget and the effectiveness of your operation?
Well, if I didn't have the policy of the children or the staff being able to take off when they were sick, I would have more of a problem because I would have people calling out more often, and I would have people being sick or coming to work sick, spreading their germs and making other people sick and keeping the children sick. And in child care, it's like once someone gets sick, it can spread through the whole center. And next thing you know, you're sending out letters telling parents, we have an outburst of pink eye, we have an outburst of the flu, we have an outburst of strep and that's not good for business. So it's better, you actually save when you have the consistent teachers, you have consistent, when parents get to know your policies, they're comfortable with the teachers, they're used to seeing the same teachers. It's okay for them to hear to say, your teacher's out today because she doesn't feel well. It's normal. It's normal. So we want to bring that normality to all small businesses, and I'm a very small business. I only have 26 children, so it's not like I'm rolling in cash at all. But I just know the importance of it, I believe in the importance of it, and I respect other human beings enough to say it's worth it.
Thank you. Chair recognizes Councilman Nielsen.
Thank you, Madam Chair. Thank you all for your testimony, and coming here today, taking time out of your busy day schedule to come. Got a couple questions, and first off, none of us started as a council person. My first job was in a restaurant. I busboyed. I brought in Venango to the old Fisher's restaurant. If people from Philadelphia know that, it was an icon. And so we all started somewhere. Do you see any problem when people calling out sick at a short notice? Because we've heard some businesses come in and talk about how they could be affected, and they wouldn't be affected as much if they had like 2 hours notice and, hey, look, I'm not coming in. Or say on a restaurant shift, whereas you call in for a waiter or a waitress or server to come in, and they only want an hour sick time. So you already need to replace someone, and to bring someone in at $2.40 an hour for an hour to cover that shift. How do you make up for that kind of stuff? Because there's some of the things, some of the people that came to us, they said, look, I need a couple hours, or I need someone to take off 4-hour increments or 2-hour increments. I mean, some good arguments, but I mean, how did that affect you? And how does Washington, your policy work at your place? Do they have to take off a whole shift? Or do they just take off an hour, they take off 2? I mean, because if you have a doctor's appointment, you only want an hour. I don't want to take off the whole day. And some doctor's appointments can't be avoided. I mean, there's some things we can't avoid. Please, I'm sorry.
No, well, I think one of the things, once it took a bit of education for employees across the city to kind of understand that the law is in effect. I think once they've understood that, that kind of late call out, because often he can speak to it himself. A server or a bartender, someone in the kitchen is trying to rally and trying to feel better to come into work, and then perhaps the last minute they have to call out because they just don't have the strength to come in, or just they're worried about affecting other people. Now knowing that they actually have some of their time covered, they don't, that tension of that worry about should I call in, should not call in, doesn't happen. I think, and also, I think for the most part, whether you talk about a short term, whether them themselves have to go to the doctor, or many of my employees actually have children, their children have to go to the doctor. When it's unavoidable during a shift time, they've worked it out with the managers, be it in the kitchen or in the front of the house, to either do some small coverage or come in later. But we adjust because, again, we found here, and I found in my restaurant, in my market, that if I take care of my employees will take care of me.
Amen. No doubt about that. Thank you.
What's the name of your restaurant?
It's called Cork Wine Bar, and the specialty food store is called Cork Market and Tasting Room in Logan Circle in Washington, D.C. Nice plug there.
Thank you.
It actually sounds like something we can use here, Madam Chairwoman, a Cork Wine Bar.
Leave a card, please. We're going to Washington soon, so we have to stop by.
Well, we'd love to have you. We'd
Thank
love
you.
to have you.
Any other questions? Thank you so much for your testimony. It's very informative. We appreciate you coming from D.C. to share with us what's happening down there. Appreciate that very much.
This is very important.
Thank you.
Thank you.
We have our next panel with Dr. Walter Sue, Commissioner, past President of the American Public Health Association and former Health Commissioner of Philadelphia, and Lynette Lazarus, retired school nurses. Is Ms. Lazarus here? Okay. She had to leave. Yeah.
Well,
hello. How are you?
hello.
Thank you for coming in.
Thank you, Councilman Tasco, and thank you for your service to Philadelphia and to all the other members of council. My name is Dr. Walter Sue. I'm a public health physician, past president of the American Public Health Association, and as mentioned, former health commissioner of this great city. And I am here today to speak in favor of City Council Bill 141026. It's been previously noted about 40% of Philadelphia workers do not have paid sick days, and this is not equitably distributed, as low-income workers are much more likely to be without sick days. And we can state with 100% accuracy that every day someone in this city will get sick or injured. Those who work for employers with paid sick days can use this to seek medical attention, rest their injured body, or avoid coughing on their fellow workers. But on those who do not have paid sick days, many will exacerbate their illness, as Mr. McCarthy said eloquently, by bearing more weight on an injured leg or ignoring their chest pain at great personal peril, or possibly worse, spreading their communicable diseases to their fellow workers. In my career, I have witnessed food workers who have gone to work with viral hepatitis infecting salad bars, people going to work with fever and flu-like symptoms, and workers coughing on their fellow employees with multi-drug resistant tuberculosis. This legislation recognizes that sometimes it is in the best interest of society for workers to stay home. It's also in the interest of society to have a healthy and productive workforce. And while in the short run a sick worker may be away from work, recuperating or caring for a loved one, in the long run they will be more productive if they can get their illness treated or controlled. There are some in the business community that have expressed their opposition to this bill, but there are many employer rights that are mentioned, and I won't go through them for the sake of time. In short, if you get sick days, you have to earn them. Some employers fear employees will abuse their paid sick days. A small minority might, and there are remedies for those who falsely claim sickness. Inevitably, though, your choice is whether you deny everyone paid sick days to avoid this small minority, or do you set reasonable rules based on the fact that bad things happen on average to everyone? It is actually in society's interest to level the playing field so that all workers in Philadelphia have a minimum number of paid sick days, which is the responsibility of City Council, and why I support this legislation. Thank you very much.
Thank you very much. Chair recognizes Councilman Greenlee.
Yes, thank you, Madam Chair. I just wanted to thank Dr. Sue. I think he's been here for every hearing that we've had over these years. He's spoken at public comment, and certainly your expertise and your service to the city and to the healthcare industry generally is really appreciated, and certainly your support of this bill means a lot. So thank you, sir. Thank you for what you've done on this.
Thank you very much. Any other questions or comments? We really appreciate the service to Philadelphia. Thank you for coming.
Thank you.
Next panel will be Mr. Dan Callista, Mr. Joe Grace, and Mr. Al Tautenberg. Good afternoon.
Good afternoon.
Thank you for your coming out to testify. We'll have now Mr. Callista.
Councilwoman, if it's okay with you, may I go third? May I go after these other
You want to
gentlemen?
go after them? Okay. All right, Mr. Grace, you ready?
Good afternoon, Madam Chair and members of the committee. Thank you very much for the chance to be here today to testify on Bill 141026. I'm Joe Grace, Director of Public Policy for the Greater Philadelphia Chamber of Commerce. First, the Chamber would like to commend Councilman Greenlee, the sponsor of this legislation, for his stalwart commitment to the cause of creating healthy workplaces in Philadelphia. We all support a healthy workplace environment that is safe for employers, workers, and customers. But we wanted to take a moment to commend Councilman Greenlee for his work on this legislation. Our Chamber members are committed to their employees and the public's health as well. When we surveyed our members last year on this issue, 85% responded that they already do provide paid sick leave or paid time off to their employees. At the same time, 70% of those respondents said that they did not think that Philadelphia should require businesses specifically to offer paid sick leave. As those survey results reveal, the issue for the Chamber and its more than 2,000 businesses that are located here in Philadelphia has never been about providing paid sick leave, since so many of our members already do provide it. The issue is one of competitiveness. When the City of Philadelphia imposes mandates on businesses here that other neighboring jurisdictions do not impose, that puts city businesses at a competitive disadvantage. Our businesses already operate under what is considered one of the higher local tax burdens in our country. Our members need a local tax and regulatory environment more in step with enabling job creation that can help revitalize our city's economy. Nevertheless, as the paid sick leave issue comes before this council a third time, and as the Nutter administration now supports a paid sick leave law in Philadelphia, the Chamber has spent the last 9 months actively participating in the work to craft a paid sick leave policy. The Chamber participated fully in the work of the Mayor's Task Force on paid sick leave, with Lisa Crutchfield, our Senior Vice President for Advocacy and Public Affairs, and Dan Callista, sitting right here with us today, CEO of Vynamic and a Chamber board member, both serving as co-chair of the Mayor's Task Force at different times. After the task force issued its report and this legislation was introduced by Councilman Greenlee in December, the Chamber spent the last several months working with our members and City Council, seeking a number of modifications to the bill to make it less adverse to businesses in our city. With the backing of the city's business community, we support the following amendments to the legislation before this committee today. An amendment stating that nothing in the legislation will require an employer to change an existing leave policy or provide additional sick leave if their existing policy satisfies or exceeds the accrual requirements of the bill. An amendment providing that no person who is transferred on a temporary basis, less than 12 weeks, to a location inside the city, whose primary work location is outside the city's boundaries, shall be considered an employee covered by this ordinance. An amendment that requires employees to give reasonable notice, 10 days, to their employer when they know in advance that they need to use sick time, such as for a doctor's appointment, and to generally comply with their employer's notification procedures. An amendment allowing workers to use their sick time allowance in 4-hour increments, not in increments smaller than that. And just to add, Madam Chair, that the Mayor's Task Force specifically recommended this step very specifically for the restaurant industry here in our city, which requested that step, and I think you heard earlier testimony and questions from council members on that point. And any other language sought by businesses in Philadelphia intended to make it easier for the company to comply with this ordinance, but still maintain their daily focus on being a profitable, competitive business here in our city. Just one other issue needs addressing. Responding to many chamber member concerns, we urged council to increase the employer threshold beyond the current level of 10 or more employees. The chamber did advocate for an employer threshold of 50 or more employees, applying the designation of a small business as defined under federal law, under the Family and Medical Leave Act and the Affordable Care Act. Understanding that there was little support in council for this position, the chamber now respectfully asks this committee to consider setting the employer threshold at 15 or more employees, which is the recommendation set forth by the Mayor's Task Force. In conclusion, on behalf of all our member businesses in our city, we ask council to consider these two important points before voting on the legislation. We all support a healthier workplace, and we all support policies that help our businesses remain competitive and profitable here in Philadelphia. Madam Chair, members of the committee, thank you for the chance to testify on this legislation.
Madam Chair, thank you very much for the opportunity, and thank you, Councilman Nielsen, Councilman Greenlee, Councilwoman Sanchez, Councilwoman Bass, Councilman Brian O'Neill, and Councilman Kenyatta Johnson. We thank you for the opportunity. The jobs of a Chamber of Commerce is to attract, retain, and grow jobs in our city. To be very direct, although I see this as well-meaning, and I see the reason and the passion behind it, the problem is that in Montgomery County, Chester County, Delaware County, Camden County, Burlington County, Gloucester County, Chester County, this bill will not be introduced or ever even considered. The fact of the matter is Philadelphia must be competitive. And one of the words I use is grow. Well, I know a little bit about growing things because I have a degree, Bachelor of Science degree in agronomy from Penn State University School of Agriculture. The fact of the matter is you have to have good soils. You have to have a lot of good climatic conditions, all of which we have in Philadelphia. We have a pretty good trained workforce. We have people that want to go to work, want to start jobs, entrepreneurs. These new jobs, these entrepreneurs have to be encouraged so they can develop, and again, to use the word grow. What is happening here with increased taxation and increased regulation, we're letting a lot of weeds sprout in what could be a very, very good garden, a garden that could give rise to major companies in time right here in Philadelphia. This is being stifled, this is being hampered, this is being crowded out with sunlight. If you ask a CPA, take any CPA, I will say 9 times out of 10, tell them what kind of company you want to start. When you say, where should I start it? They will not recommend Philadelphia, even though they might be in the city itself. I think these amendments certainly should be seriously considered because entrepreneurs need to grow. 100 years ago, the Dodge brothers started a little car company. It was on TV. You know what? It developed into something very big, a jobs that give sick leave. But the fact is, these entrepreneurs have to have that opportunity to grow. This bill in its present form will not do that. Thank you.
Thank you, Councilwoman. My name is Dan Callista. Good afternoon, everyone. And members of the Public Health and Human Services Committee, thank you for having me. I'm a tax-paying resident of Philadelphia. I'm a business owner and an entrepreneur. I'm also proud that my company offers paid sick leave. Today, most relevantly, I am before you as the co-lead of the Mayor's Task Force on paid sick leave. Thank you for having me. The 26-page task force report was put together by meetings over 20 times together. These are my notes. We worked hard as a group, and I'm really proud of the service that the citizens of Philadelphia that came together worked on the task force. We had various backgrounds. We took many hours out of our jobs and our personal schedules to contribute. Hundreds of hours diligently making recommendations reflecting a compromise of different points of view. Yet with the united intention of a healthy and vibrant Philadelphia community, we all came together for a common purpose. And because the task force felt paid sick leave is an important issue, we all worked so diligently. I believe City Council should do more to represent the recommendations of the task force. It's a compromise. It should be respected. We worked very diligently as a task force. I read the February 2nd draft of the proposed amendments to the bill, number 141026. And while substantial, well-intentioned, thoughtful improvements have gone into it, there's more work to be done. It's not ready to go to work. It's not 100% ready yet. We're almost there. It's been a long journey. I hear what you said about the long journey. There's more to do. I'm going to get specific because the details are important. I went line by line through this report. We spent hundreds of hours with fellow citizens working on this topic, and I believe we came up with something important that should be respected. I have two summary issues, two categories of main things, because a lot of work has gone into this report and into the legislation. One of them is the definitions of employee and employer. The second is the use of paid sick time. First, the definition. There's a definition in Section 3, 9-4103 of an employee. A lot of inclusions have been done there, which I was happy to see from the task force recommendations. There is no mention of part-time employees. The task force made a recommendation on page 22 of the task force report that part-time employees working on average less than 15 hours per week over a 90-day period should be exempt. The intention behind that was to encourage companies to bring in part-time workers. If they work 5 hours here, 5 hours there, that might lead to a full-time position. That might lead to a more regular position. That was the spirit of that, and I believe that should be respected. The second piece to the definition is on number 4, the employer, and this has been raised, of course, today. Currently, employees, fewer than 10 employees. As we know, as we've heard today, legislation is proposed is at 10. The task force really worked hard on this topic. Many, many hours, very serious, very diligent hours were spent on this topic. We recommended that employers with 15 or more employees. Why 15? All right, it's just for simplicity, for clarity of entrepreneurs. So the EEOC, the Equal Employment Opportunity Commission, has a threshold of 15. And all we were doing as informed citizens were to look at some existing legislation so that companies, these are small companies that are 10 to 15 employees, that there's some consistency. That's all they were looking for. Just somewhere in the law there'd be a place of consistency. And there were other thresholds you could look at. Frankly, we were looking for one of the lowest thresholds that we could find so that definitions of small business can be done consistently. All right, so that was the first area. And then just and kind of going into the second topic of just the use of paid sick time. The legislation that is proposed in 9-4105, Section 4, legislation reads, accrued sick time may be used in the smaller of hourly increments or the smallest increment that an employer's payroll system uses to account for absences or use of other time. We discussed this a lot as a task force as well. A lot of work went into this. There was an inclusion around that the task force put on page 23 of our report that restaurants may require employees to take leave in 4-hour increments. So the task force believes and wants the restaurant industry to offer paid sick leave. We just received a lot of testimony from the restaurant industry, and we're hearing it from different angles here, that it should be reasonable to have 4-hour increments. Imagine getting a notice at 12 o'clock on a lunch rush. All the request is offering it in a half-day increment. Offer paid sick leave, but have it in a half-day increment. And if you don't want to carve out the restaurant industry, look for a carve out for 4-hour increments in the legislation to allow for that as a minimum threshold. Employers can do more. And then secondly, legislation says in Section 5 of the same area, 9-4105, Section 5, the next one below it, For sick time of more than 2 consecutive days, an employer may require reasonable documentation that the sick time is covered by the subsection 1. Okay. The task force made a recommendation on page 26 that employers may require reasonable documentation for sick leave use. And I could go on the exact paragraph there that you have on page 26. Reasonable documentation only on the 3rd day, right? Greater than 2 means the 3rd day. So an employee can be out for 2 days in a row, come back to work, 2 more days in a row, come back to work, 2 more days in a row. If you look for a total of 40 hours that's proposed, there's no documentation. It seems reasonable to ask for documentation. If given the legality of it, given proper notice, given all the proper things that this bill went through great length in the legislation to spell out, it's just asking for the ability to ask for legislation. And so, in conclusion, that I believe that the paid sick time legislation is in fact well-intentioned. We want parents, we want caregivers, we want individuals to be able to care for their loved ones and themselves without the very harsh realities of unpaid sick time. You're doing a good fight. I appreciate the work that's being done. You just got to do it right. I believe the details are important. These are just minor details that we're talking about.
Yep.
minor details here, and you're almost there. It's been a long journey. This legislation needs to be healthy to go to work for the people of Philadelphia. Thank you for the opportunity to be with you and accepting my testimony.
Thank you for your testimony, Councilman Greenlee.
Thank you, Madam Chair. Ms. Callista, first of all, you use the word respected numerous times, respect the work of the task force. I can certainly tell you, I think I said it to Ms. Lefkovich, and I'll say it again, I said it in my open statement, we certainly respect the work that the task force did.
Thank you.
I work with the mayor to get members on that task force. So I think and I got to say, you got to insinuate it because you kept saying it should be respected. We certainly respect it. And we respect the hours, you talk about the hours that were put in here. I got you. With all due respect, I spent 8 years on this. Okay? And a lot of other people spent years on this. So please don't sit there and act like you were and the task force was the only people that worked on this.
Everyone's working on it. We're almost there.
And when the mayor put this task force together, I believe he used the word advisory, that this was an advisory task force. That meant that in the end, it was up to us and him and those that vote on this law to make a decision on it. I would dare say that 90 to 95% of what the task force recommended is in here. There's some things we disagree on. You used the word a few times, do it right. That's right. Yeah. We think we are doing it right. And with all due respect, I don't think you're the only one to judge whether we're doing it right or not.
Details are important. Don't you agree? We got to get it. We can't just congratulate each other. We need to respect the details that went into this. Let's do it right. Legislation well-intentioned. I'm not going to debate with you. Legislation well-intentioned can have problems. Let's get this thing right. Let's do it.
So you don't think it's right? I think it's right.
That's why I testified.
They think it's right. So a lot of people think it's right. And in fairness, I would probably, if I was going to change it, I'd change it in the opposite direction of what you're talking about. But regardless, I'm not going to go over every point. We're just not going to agree on some things. I will say one thing on the one issue you raised about there should be documentation right away as soon as a lot of these people, and I think Mr. McCarthy pointed this out, a lot of the people who have to take this time and do not have sick leave now, because I'll remind you, if you're dressed like we are up here, you got paid sick leave. Yeah. But if you're wearing an apron or a smock or something like that, you probably don't have paid sick leave. And what you also don't have is probably the greatest health benefits. So to say the person, if they're out one day, has to go to a doctor and documentation, I don't think is fair. I don't think that's fair. I think this is a good balance. And balance, I think, is a word we use a lot in trying to craft all kind of legislation, not just this. And I think a balance, when you're out more than 2 days, I think it's fair to ask for documentation. And the scenario you gave, and I have to keep going back to this, because we can't, you gave what I would call the worst-case scenario, which is somebody's going to stay out 2 days, come in, stay out 2 more days. You know, are there some human beings that would try to take advantage of that? Sure. Right now, I guarantee you there's an employer taking advantage of an employee, okay? Not the majority. It's not the majority of
Councilman,
employees
I'm
or
just saying that when we
employers, but
think
what
we
let me
introduce
finish,
legislation,
okay? I didn't
let's just-
interrupt you. I didn't interrupt you. Let me finish, please, okay? Again, I think we're trying to reach a balance. I think we got it right, and I guess that's up to the council to decide who's right or wrong, and I'll just leave it at that. Ms. Taubenberger, one real quick question to you. I know you said that, and I know you've brought this up before, that the state, that other surrounding counties don't have this law. And I would agree that in my perfect world, first of all, the whole country would have it, first of all, but at least the state of Pennsylvania should have it. Would you think that would be better for...
Listen, the larger you can make this, the better. And having it in the Pennsylvania, yes.
Okay.
Keep in mind, it's still very, very competitive nature. I would, if you're going to have it, the nation would be best. Pennsylvania would be second, but Philadelphia alone is not a competitive situation, and it troubles me.
Okay, all right. Well, I think we should move it now, but in order to keep it more competitive, would you go up to Harrisburg and lobby for a statewide law for paid sick leave?
Would I go to Harrisburg?
I didn't hear the answer.
I certainly will go to Harrisburg with you, Councilman Greenlee, to talk about this. Because you know what? Once again, if it's larger, it's more palatable. If it's smaller, the smaller this is, the more it hurts and fetters our young entrepreneurs you know what?
Quiet. Let him finish.
The Dodge brothers didn't start with a multi-million, billion-dollar operation.
The Dodge brothers was 100 years ago, Al. That was 100 years ago. 100 years ago, people didn't have any kind of benefits.
Well, some did. That's not true. And 100 years from now, there'll be a different situation again. But the fact is, I'm for growing businesses, and you need to have the right climatic conditions, and we don't.
Okay, we differ in opinion on that. Okay, I'm not going to keep going. Thank you, Madam Chair.
I remember when we outlawed smoking in the restaurants, and everybody was going to go to the suburbs to eat. Now we got more restaurants and more are coming, and now they in the suburbs have stopped smoking. Because I didn't like going to some of the restaurants in the suburban area because they had smoking. And now everybody has outlawed smoking. So
well, that is correct,
we set the tone and the trend, and I think this will move right on out through the suburbs.
Councilwoman, I respect you a lot. I hope and pray you are correct. But if you're not, I'd like to come back and talk about it. Because I believe in my heart, Philadelphia must be competitive to get jobs growing.
Liquor by the drink. Folks were going to run to Montgomery County to the suburbs to drink liquor. Can't get in the restaurant downtown, okay? They're not leaving. So we appreciate your representation for your community, the business community. We just ask them sometimes to think about the people that are in there, to buy their food, who service them, to think about those folks for 1 minute. Just think about it, okay? So when this council dealt with the issue of predatory lending, and we told you that this was hurting people and they were losing their homes, we were called all kind of names and don't pass legislation. Now look what happened. 2 years later, the whole market crashed around because of predatory lending. So this council has been pretty right on the legislation we have passed, and we will disagree. And the discussion is always to be open, and the dialogue is to be open, and we appreciate your point of view, but we kind of get it right, and we thank you very much.
Well, I hope you're right. I'd like every Philadelphian to have a job. Councilwoman, thank you.
If it's for the people, if it's for the people, and I know there are some people who think that we don't do a good job, but we come back because the people in this city recognize that we care about them and take care of them legislatively in this body. And I just wanted to say that because the voters know who's doing what we have to do.
Councilwoman,
And I didn't mean to make a speech, but I got to get it off my chest. Thank you very much.
Well, and I appreciate your work as well. Thank you.
Thank you.
Madam Chair.
Just a minute. Hold on. Councilman Good.
Thank you, Madam Chair. Good afternoon to the panel. Mr. Callista, you talked about the work of the task force, the need for balance and compromise, and I'm interested in your own perspective since you came here and you said we're not there yet. I'm interested in what your starting point was. What was your original position on paid sick leave?
I went in, as I said in the testimony, that I believe in paid sick leave. We offer it. I believe a healthier workforce is a better workforce. I went into this because I was asked, by Greenlee and the group that put this together, and I just went into it with open mind. And we worked.
So you had no original position on paid sick leave?
No, I guess what I'm saying that my point of view was, as I was just saying, is just that I believe in paid sick leave.
Did you believe that there should be a paid sick leave law that applied to the entire city? Yes or no?
I think that the way to implement this would be with the president's manner, so the federal level.
You're not answering my question.
What are you asking, sir?
Did you start off with a no paid sick leave position?
I did not start off with a point. I went into it with an open mind.
Okay. What was your personal position? Should there be paid sick leave for the entire city?
I do not believe there should be sick leave at the city level. I believe it should be at a competitive state level.
Should there be paid sick leave?
Sir.
If you answer the question, you won't have a problem.
I'm trying to.
Do you believe that there should be a paid sick leave policy for the city of Philadelphia? That's a simple question. Is that where you started out?
I already answered the question. Yeah, I believe there should be sick leave beyond Philadelphia, including Philadelphia. What else can I say?
So I'll answer it for you. You did not believe that there should be a paid sick leave policy for the city of Philadelphia.
It should be only Philadelphia. Don't we all want more than Philadelphia?
So what is the compromise?
Right? Like that's,
so what is the compromise between no paid sick leave policy and paid sick leave?
I don't understand your question.
What is the compromise? If you start out not believing in paid sick leave for Philadelphia, and there are people who believe in paid sick leave for Philadelphia, then what is the compromise? The compromise
is in the details, sir, in the actual legislation recommendations.
So the compromise is some paid sick leave in Philadelphia?
Yes, there was compromise.
Okay, so what was the purpose of the task force?
I have the task. I think you know that the task force was put together to put recommendations on paid sick leave policies in Philadelphia.
To the mayor?
And Councilman Greenlee.
To the mayor. It's the mayor's task force.
Mayor's task.
And so the compromise between no paid sick leave and paid sick leave is some paid sick leave. Recommendations were made to the mayor and council, and the mayor and council agreed. We have no more work to be done. Thank you very much.
We worked hard on this. We worked hard on this. All I was trying to do was look at the details.
Thank you very much.
Well-intentioned.
We appreciate your effort. We appreciate your advocacy for what you believe in. Thank you very much.
Thank you.
Please, we have to have order. This is the Chamber of Congress, Council, and we respect all of the folk who come in here to testify, whether we agree or disagree. They have a right to their opinion as you have a right to yours, so we ask you to respect those who may differ from you. We ask for your respect for everybody. The next one, we have Ed Gross, Greater Philadelphia, Greater Hotel Association, Melissa Bova, Pennsylvania Restaurant and Lodging Association. The next panel will be Ms. Helen Gim, Reverend Sean James and Ms. Marianne Bellasorte. If there's anyone else here to testify, you need to see that young man over there so we can call you up because they are the last panel. Good afternoon.
Good afternoon. My name is Ed Gross. I'm the Executive Director of the Greater Philadelphia Hotel Association. We represent over 90 hotels around the region, including all of the hotels in Center City and most within Philadelphia. I'm here today to express the hotel industry's concern regarding Bill number 141026, which was introduced by Councilman Greenlee and would require Philadelphia employers to grant paid sick leave to their employees. Bill number 141026 provisions allowing employees to be absent with little advance call-out and allowing employees to take their leave in 1-hour increments cause a particularly undue burden on other employees and will wreak havoc within the service industry or within service delivery in hotels and restaurants. Employees will be forced to stay over or will be called with little or no notice on their time off. Businesses will incur excessive overtime costs and temporary labor costs of covering for absent employees. Customers will often receive poor service while managers scramble to fill unexpected staffing vacancies. Many of those customers will choose to spend their money elsewhere in the future rather than submit themselves to such aggravation and poor service again. Most hotels, pretty much all hotels in Center City, have policies in place which are far more favorable than the requirements of this legislation. However, granting 5 days of paid sick leave a year would be a major financial burden for many smaller hotels and independent restaurants, and larger companies manage their employees' time off in many different ways. The Federal Family and Medical Leave Act requirement sufficiently covers the concerns addressed by this bill, and it should be an individual company decision, not a city mandate, to adopt a more lenient sick policy. Ultimately, the policy proposed in Bill number 141026 will increase labor costs for our hotels. If forced to absorb the increase, the result will be higher prices for our customers, fewer people visiting Philadelphia, less vacation dollars spent in Philadelphia, and a reduction of the number of jobs available in our industry. Currently, it's nearly impossible to build a hotel in the city without significant state and city subsidies, as major chains prefer to locate in cities with lower taxes and labor costs. The added cost of mandated sick pay will only serve to make our destination less attractive and chase away already skittish developers. Philadelphia hotels generate over $125 million annually in tax revenue for the city and Commonwealth through real estate, wage, liquor, use and occupancy, and amusement taxes. I am hard-pressed to imagine a more taxed industry in our city than the one I represent. There are over 11,000 hotel rooms in Philadelphia, employing 10,750 people, 80% of whom are Philadelphia residents making an average living wage of $24,000 a year. They live in every neighborhood of our city, and GPHA works closely with agencies such as Philadelphia OIC, Congreso de Latinos Workforce Development, and Philadelphia Academies to ensure a diverse workforce from the frontline employees to upper management. Our employees look like Philadelphia, and these are the jobs that will be in danger if this proposal passes. Now is not the time to make it even more difficult to do business in Philadelphia. The Greater Philadelphia Hotel Association urges you not to pass Bill 141026.
Thank you. Chairwoman can you hear me? Sorry. Chairwoman Tasco, members of the committee, thank you for allowing me to testify before you today. My name is Melissa Bova, and I am the Director of Government Affairs for the Pennsylvania Restaurant and Lodging Association. Our association represents over 500 hospitality businesses in the city of Philadelphia who are willing and prepared to offer paid sick leave in the city of Philadelphia. A week ago, though, I had planned a very different testimony for today. That was because a week ago, I was cautiously optimistic that I could tout support for a bill that not only achieved the goal of its sponsor, 1 hour for every 40 hours worked, up to 40 hours a year, but also took into consideration the uniqueness of the hospitality industry. Unfortunately, today, on behalf of myself and my members, I'm frustrated and I'm disappointed. I would like to take a moment to detail why that is the case. Historically, as you know, the Restaurant Association usually comes before you and opposes pieces of legislation like this. We've come a long way since that time. When Mayor Nutter first appointed his paid sick leave task force, we met with many council members and expressed the fact that we were not included on the task force, and we urged you to consider our industry when legislation is revealed. Out of those meetings, council members expressed support to our members about taking into the uniqueness of the hospitality industry. We left those meetings with a plan. We came up with an in-house task force representative of our members. This included hoteliers, fine dining establishments, quick service establishments, and everything in between. We did not convene this group, as I said, to dispute the idea of paid sick leave. We put this group together so we could look into the nuances of the legislation and determine what clarifications and changes we may need to still be able to function while achieving the goal of the bill. We want to achieve the goals of this legislation. We are not opposed to the goal of this legislation. The amendments that we created address concerns that we feel the legislation did not take into full consideration. Many of those have been addressed already. I will go into them only briefly. I know time is running out. We ask the ability for leave to be taken in 4-hour increments. In 9 to 5 jobs, if you have a doctor's appointment and you need to leave for 2 hours, it can probably cover for you. If you have a doctor's appointment and it's from 12 to 2 in the middle of the lunch rush, that shift needs to be covered. Those tables need to be covered. If you provide bad service, you're losing customers, you're losing business. We requested the ability to provide leave in 4-hour increments so we could bring somebody in to cover a half of a shift. The rest of them, because while I try to be creative, I'm not creative. We actually have from other pieces of legislation, 2 of which are from Washington, D.C. itself, where you have heard testimony previously. We allowed up to 10 days of warning for pre-scheduled doctor's appointment. Some cities have 7, some have 10, but there's a variety of cities that have the requirement, if you have a scheduled doctor's appointment, give 7 days warning, give 10 days warning, so that shift can be covered. If paid leave is unforeseeable, this is in DC as well, the employee must provide notice as soon as practicable. It's in the legislation, but must generally comply with the employer's reasonable normal notification policies. Somebody mentioned it before. In the legislation itself, it says advance notice. It doesn't say that the employer can keep their current employee manual. We have members that say, give us 2 hours notice before you call out so we can cover the shift. We're just asking a clarification to allow those employee manuals to stay in place. The final one is in Portland. This was speaking to the very few, 95% of people will not abuse this. But if you have an employee that calls out on Valentine's Day or New Year's Eve, you might not be able to open that night or provide that type of service. So if it's a mandatory shift, you take a week vacation and you call out the day before your vacation. Allow the employer to ask you to provide notice or sign a form saying that you use this leave for the proper usage. And we met with many of you after we developed these amendments and talked to you about them, in addition to the mayor. The mayor and every single person we met with, except one, voiced support to the idea of these amendments. In fact, many even said that if it was their employees, they would want the same types of provisions and protections. In my experience of legislative work, compromise is what creates the best pieces of legislation. Amendments are going into this bill, but not one single thing that we asked for is being considered or put into this legislation. Our hope was with the adoption of these amendments, we could sit here before you and say that the hospitality industry is supportive of this legislation. I cannot even begin to express how frustrating it is to bring members and restaurateurs and representatives of the hospitality industry into the legislative process, have positive meetings, and then find out a few days later that not a single conversation is being taken into consideration, and the needs of an industry that employs over 60,000 people are not being addressed. As I said at the beginning of my testimony, we are frustrated, but we still want to work with you. We want to work with you. Please work with us. To be more helpful, I do believe there was concerns about the fact that some of the items we were asking for were not in other cities. I have pulled the legislation from other cities and cited specifically where some of those provisions are in the legislation. As I said, please consider these 4 amendments and consider the hospitality industry. We want to support this legislation. We want to provide leave. We just need to be taken into consideration in the process. Thank you.
Thank you very much for your testimony. Councilman Greenlee would like to respond.
Yeah, thank you, Madam Chair. First of all, Ms. Bova, let me just say, I met with you, and I think I was the one that you probably referred to that did not agree with you. It wasn't that we didn't take that into consideration. I try to take, personally, everything into consideration. Sometimes people don't agree, you know. I think there is language in this bill presently that really covers what you're saying. Or for the most part, maybe not every single part, but for the most part. Just for example, when the need for sick time is known to the employee in advance, such as for a scheduled appointment with a health care provider, the employee shall provide notice of the need for such time to the employer in advance.
What is
now,
advance?
It doesn't give a specific time, because sometimes you don't know if you may get your appointment 5 days before,
Absolutely.
or 3 days before, or 7 days before. So I think to try to put a distinct time on there, in my opinion, won't work. And, you know, I know you said some cities they have various regulations.
7 to 10, and a majority of them have that specific clarification in the
That's not what I
language.
found, but all right, I'm not going to get a debate about that. The problem is that the fact is, if an employer feels that an employee is taking undue advantage, like for example, I know when we met, I forget who it was that suggested it, somebody could come in 2 days later and say, I was sick the last 2 days. Well, that employer would be absolutely within their rights to not give them the sick leave, because clearly that is not reasonable. We use a reasonable, practicable application here. And the reason we keep it general like that is, yeah, could an employee try to take advantage of this? To be honest with you, if you make it too specific, an employer will try to take advantage of it. It can go both ways. And we're trying to find, and talking to a lot of people, we thought that this was the best way to do it. It's not that we don't respect restaurants. We're glad we got a restaurant city here. I will say, though, and I have to put this on record, just to be fair to everybody, that most of the complaints we heard from employees over these 8 years that we've been dealing with this bill in Philadelphia, the majority of them came from restaurant employees who said that restaurants did not treat their people fairly, and gave various examples like the gentleman had today. I'm not saying that's a majority. I don't think it is. But I don't think it's a majority employees that is going to try to take advantage either. I think, as in anything, we're trying to reach a balance here. And so again, I want to assure you, we're not trying to ignore restaurants. We've gotten letters from lots of restaurants, you know, advocating their position. I understand it. I just think that our legislation covers, without being as specific as maybe you folks would want it to, covers what would be any kind of egregious activity by employees. And in fairness, I think a couple of things that you're asking for here is so general that I could really see being a problem. When you say employer's reasonable, normal notification policy, well, what's that? You know, what's normal and what's reasonable and normal to you might not be reasonable and normal to me. So
Can I address
think
a few
all
of
that
your
would
comments?
do is generate more complaints, that more people, either employer or employee, would be putting in complaints if that was the case. And just one other thing, indication but not limited to repeated use of unscheduled sick time. Again, very general term, and I'm really concerned about putting something that general in that could really affect, that could be misused clearly both ways. And I don't think, as the gentleman from DC said, you know, I think you adjust as time goes on. And I don't think you're going to have to adjust as much as you think. I think oftentimes you're thinking here about the worst case scenarios. And again, are there a bad employee here or there? Sure, because we're dealing with human beings. But I think most people, if they're treated right, will act right. And I think that's the way, I think that's what you'll see here. So, and lastly, as the chair said, nothing is written in stone here. If we find out, as time goes on any issue that's brought up here, either by the supporters or the opponents, as time goes on, if we find out that there is a problem with that, we can always put in another bill to amend that part out. Personally, I don't think that's going to happen. You know, I don't think Philadelphia is going to be that different from all these other cities and states. But if we find out there's a problem, we'll deal with it. But I think after a while, you have to make a decision. And if you keep amending stuff and taking the possibility of more people not getting sick leave, and, obviously that's not the intention of the bill. The intention of the bill is give people sick leave and give it reasonable to both employees and employees. So again, as time goes on, if there's changes to be made, we'll certainly talk about those changes.
May I address just a few points that you made? You're right. If an employee calls out on Valentine's Day and an employer says, or calls out for 2 days, an employer says, okay, I don't think this is fair, I'm going to let you go. There's recourses in this legislation for an employee to ensure that the business is ensuring paid sick leave. There's nothing in here for the businesses. There's nothing that protects us. All we are asking is the ability to have a normal leave policy. Your legislation says give advance notice. What's advance notice? So if somebody calls out 30 minutes before the shift and says, I'm sorry, I'm not feeling well that's advance notice. So now I have restaurants that are going through weeks of proving their records and showing records when all we're asking is for the ability, if you have a 2-hour warning window, let us be able to have that. It's literally clarifications that we're looking for here. That is all we are asking. We want to be able to support it. So that's, and like I said, I didn't invent the wheel here. The warning for, and you're right, if you have a doctor's appointment 5 days ahead, that's not what we're asking for here. We're saying your yearly physical, you have a dentist appointment, give us a week's notice, let us cover the shift. That's what we're asking for here.
That shouldn't be very difficult. Most doctors can't give you an appointment for 6 months. So they should know pretty much
Agreed.
when they're going to have a dental appointment.
That's exactly your
unless it's an emergency.
Agreed.
Being a patient of doctors. I know. Thank you. Councilwoman, you finished? You finished?
Yeah, I'm finished.
Yes.
I want to add, because, we've met with all of the industry. I think on this piece of legislation, everybody has been as deliberate as they possibly can. I think Councilman Greenlee was very cooperative with the task force, and we've met around this. What are these non-emergency issues? I think the bill sponsor is more than willing to look at any potential abuses. This is going to be in a complaint-driven kind of scenario. But I just want to say for the record, because I heard the chamber earlier and now as Ed speaks about the hotel industry, we give tax credits and benefits here to I have been in council 7 years. There's not been a hotel that has been built in this city where this council has not said tax breaks, TIFs, everything. We've proven time and time again that this industry in particular is very important to us. But like the councilman said, where we heard a lot of the very sad stories was in the Restaurant Association. And what I encourage you to do, as we've done with the task force, is let's work through this implementation process, because I think there's a lot of information that has to be shared both with the restaurant industry and the administration around how we're going to regulate this, how we're going to monitor this. But for us, it's very disheartening to always hear, the doom and gloom. I think every piece of legislation that we've done has been extremely thoughtful, and I think there's, I'm glad that you're willing to work with us as we do this implementation process. But we did hear you. I think the terminology situation, we could play wordsmanship with this legislation and never get it done. And I've learned in this council that we never make perfect legislation, but we definitely try to improve on what we've done. So I just encourage this particular industry to work with us, because this is the industry that is going to be the most impacted, but this is also the industry where the workers need to be the most protected. And so we have an obligation on both sides of it, and we're committed to continue to work with that. But I definitely don't want there to be a record that we weren't considerate and there wasn't a lot of thought to it. Councilman Greenlee, and our law department, everybody worked extremely hard to make sure if you have an employee that calls out 2 days and comes back, or calls out on Valentine's Day and it's in a restaurant worker, I can guarantee you're going to find another reason to get rid of that worker. That sick day is not going to be the one. That's an employee that you don't want anyway. So And I only say that because I don't, and I'm glad you've clarified it towards the end, I don't want anyone to think that the industry is not for sick leave, because we've met with a lot of folks from the industry who do this and do this well and value their employees. And so I just think that this is a step in the right direction, and everybody in this table is willing to work through the implementation process to make this as seamless as possible as it can be for the industry. So thank you.
Any other questions or comments? Mr. Nielsen.
Thank you, Madam Chair. Thank you both for testifying today, and I am one that has met with you on many occasions on many of these issues. And I have to say, I've met with Councilman Greenlee on these issues as well. And there was not one day where he shut his door and did not let me in. Although we agreed not to agree on things, we came to conclusions, and today he is putting forth amendments, some of the concerns of the business community as well as yours that will cover it. I want to echo Councilwoman Sanchez's point, is the regulation process. The regulation process in this legislation is probably going to be the most important one as this goes forward, because as we all see, the handwriting on the wall today is it's going forward. But that is going to be a key to make certain that you play a key role into that, so this can be further defined. Those gray areas have to get taken out of it. There are gray areas with every piece of legislation that we pass in City Council, and hopefully we can work out those concerns. And I'm certain that Councilman Greenlee will have me by his side and all of us by his side, so we will try and work out all those concerns, and hopefully we'll have a better workplace for all Philadelphians. And thank you for coming in and supporting the concept. I think that took a lot. Sometimes we have to swallow a little bit of pride and say, look, we love it, but we like it. But thank you for all you do. 60,000 employees is nothing for us to sneeze about. We do take your concerns seriously. And I just wanted to let everybody know that, and thank the councilman for, on the record, for everything, the conversations we've had in the late nights. And Bill and I have spoke dozens of times. And I'm a labor guy. I mean, everybody knows that I come from a working class family, and I come from the construction industry, who never got a paid sick day in my life until I joined government. But I understand. I understand it. So I look forward to working with you in the future and making our city brighter and a better place for all the workers and the people that visit. Thank you, Madam Chair.
Thank you.
Thank you very much, Councilman Nielsen, and recognize Councilman Good.
Thank you, Madam Chair. Good afternoon, and thank you for your testimony. Questions for both witnesses. There are hotel associations and restaurant associations in cities where paid sick leave has been enacted. Did you reach out to those associations? If so, what did they tell you about their experience? And if not, why not?
We have reached out to other associations. I would say it's a mixed bag. A lot of the cities that have already passed it have just started implementation, so they really haven't figured out quite how to work it yet. For example, there are some small businesses that are struggling with it that we've heard from other associations. Others have found a way to adapt. So it's a mixed bag, and that's honestly, as I said, we've always opposed this. And we've looked into ourselves as an association, we've talked to our members, we represent the whole gamut, and we said, okay, we can do this.
So the mixed bag is we don't know how to work it out yet, or it's working. No one told you that it's not working.
I have not had any association say that they've had businesses close because of it. I have had associations say that they have had to hire less employee. I've had businesses say that they've had to raise prices. I have not yet heard an association say they've had to close because of this.
Please give me specific examples of that.
Well, I've talked to the other associations, so they didn't give me specific.
What jurisdictions and which?
I've talked to New York City. I've talked to the California Restaurant Association, which has it in San Francisco. I've talked to those two. I've also talked to Washington, D.C. We have some members that have locations in Washington, D.C. who are doing okay. Those are the three that I have talked to.
Okay. And in the cities where there's paid sick leave and there's data, the data refutes the anecdotal
It depends on how you look at the data, and let me clarify that for you. In a lot of the polls. Oh, okay. Well, let me just. In the polling that takes place, let's say 70% of the businesses who say that it hasn't impacted them might have already offered paid leave before this even went into effect. And then you might have 15% that says it does impact them because they didn't offer it and they had to figure it out. So it depends on how you look at what amount of the businesses surveyed. Did you survey 100 businesses that never offered it before? I bet that's a little different than surveying 100 businesses where some did or some didn't.
So you're saying you don't know by the data what the data means?
It depends on.
You're saying you can't tell by the data.
I have studies that show that in some of the places where they say 70% of businesses are not impacted, it's because 70% of the businesses surveyed offered paid leave before the legislation was passed, and I have studies that show that.
Okay. But none of the associations in other cities told you that it ruined the market.
I'm sorry, what was?
None of the associations within the other cities with paid sick leave told you that it ruined the hotel market.
No, and that's why we've changed our position on it. Yes.
Okay.
For us, Councilman, for us, it's some parts of this bill that, we already, the hotels already offer, give or take 9 days of PTO a year.
Let me remind you the question. The question was, there are hotel associations and restaurant associations.
Okay, I was getting to that. I think, let me just finish, and then where we, because all of our hotels, like the Marriotts, the Hyatts, the Hiltons, they have the same policy in every city. Where we, with this particular bill, we would like to see it better defined, as Melissa spoke about, the advance notice. And then we also being able to take the paid sick leave in hour increments
So
would
you
be
don't want to
difficult.
answer my question first?
No, but I am trying to answer your question because if you look at, okay, well, I've looked at the bills in other cities.
I asked you whether you've talked to associations.
The reason, the answer to your question on that is no, because this bill is unique from the other cities.
No, the question is, have you talked to hotel associations in cities that have paid sick leave? If so, what did they tell you about their experience?
Okay, I'll tell you what they told me about. They don't have the same provisions in their bills that we have in ours. That's what I was told. It's the hour increments. We can't have our employees taken off. Like, for example, a banquet server, if they have a doctor's appointment between the hours of 12 and 1,
so did they tell you?
Can I finish, please? They cannot take off between the hours of 12 and 1 because we have to replace them with a full-day person.
You already answered my question. So I have a second question. The second question is, you have talked to them. Did they tell you that it hurt the hotel market?
We already knew it didn't hurt the hotel market.
Okay, thank you. Thank you, Madam Chair.
I think some of the issues you raised, thank you, Councilman, can be worked out with the employees and as we move along. Again, this is not set in stone. This bill can be, once we have some experience with the provisions of this legislation, and we can always come back and discuss it, and we can always come back and amend it if necessary. But we have to be given a strong argument to make that change. Councilman Greenlee.
I'm glad you brought that up, Madam Chair. Just part of the bill, towards the end of the bill, it says, 1 year from the effective date of this chapter, the agency, that's who is going to be enforcing this, shall issue a report on implementation of this chapter, which will include information on outreach efforts, number of complaints filed, and disposition of those complaints. So we should be able to judge there, after a year, what has happened. And I dare say in a year, your industries are not going to fall apart. I would go on record in saying that.
We don't believe that we will fall apart. That's why we're supportive of the legislation.
And after a year, we'll see if some of those concerns, maybe some of your concerns happened, maybe some didn't, or maybe some employees' concerns happened that we didn't see.
We just felt in this round that we weren't heard and not a single thing was considered. So we thank you for saying that in a year you will, or in whatever amount of time, you will relook at this. That's where the frustration comes from.
I wouldn't say considered, not agreed with. That's two different things.
Not agreed with.
Okay? All right, thank you.
Thank you both very much for your testimony. We appreciate it. Our next panel is Ms. Virginia Simmons, Andre Butler, Raphael Curtis, and James Meadows. They're coming next. Are they still here? panel will be Ms. Helen Gim, Reverend James, and Marianne Bellasorte. Thank you. Take it out and let her hold it. Thank you.
Good afternoon, everyone. I really
What's
thank
your name
you
first?
I'm
Identify
sorry.
yourself.
My name is Virginia Simmons, and I actually am with the group here, Action United, but I came to speak on my behalf personally why this affects me with the paid sick leave for employees and also health benefits. I've been ill for 15 years now. I'm 63 years old. This really affects me because I would not be able to live in the community without my attendant care services. And some of my attendants have been with me. I have 5 attendants have been with me since I've been out of the nursing home. Without them, I would have to live in a nursing home. I'm very independent as much as I can. But right now, the attendant that is supposed to be with me now had to go out on sick because she had a cold. A cold is detrimental to me and my health. She has no paid sick leave. And being who I am, I don't like a lot of strange people in my house. So I would like to keep the attendants that I have with me, but a lot of times I lose them because if they get the flu or something and they only have a 3-day sick day, then I lose that attendant. And that really bothers me because, as everyone knows, I don't know if you know or not, you live longer when you're out of a nursing home. Nursing homes are for people who need to be there, but I don't need to be there. I have assistants to keep me out. And it's really important to me that this bill get passed. I'm surprised there are not other people in wheelchairs here because we are really affected by this more than anybody can ever think because they are our legs, our eyes, and our hearing. And it's very important to me. And I had to be here. I'm not feeling well, but I had to be here because it's that important to me. Thank you.
Thank you. Next. Thank you for coming. We appreciate it very much. Mr. Butler?
Good afternoon, Madam Chair. My name is Andre Butler, and I'm with the Philadelphia Unemployment Project, along with Tenants Union Representative Network. And I've spoken to this council since the inception of this issue. I've also been at a couple of the mayor's task force, and so it's a privilege to be here, but obviously I really shouldn't have to be here. Today, I'm privileged to testify in this panel today because I believe it was 58 or 1959. Today was the first day an African American was admitted to Alabama University. So I'm glad to be here on behalf of unfortunately, as someone testified earlier, minorities are unfortunately adversely affected by non-paid sick days, as well as other people. And so it's an issue that's very important. I want to thank the chair, Ms. Tasco, Councilman Greenlee, who has been an advocate with TURN for over the years. He and I have had some personal differences on policies, but I thank him for his support. Councilman Good and I have always had a little bit of back and forth, but he supported paid sick days and supported TURN. I thank him for his, as well as other council members. Couple of ironies. The people who are here that sat at this panel that opposed sick days or opposed some variation of it, believe it or not, they have sick days. They've got earned sick days. So it's paradoxical they don't want us to have it. I find that kind of weird. The Chamber of Commerce people that were testifying about they want businesses to grow, keep one thing in mind, and I want to give my employee citizen opinion of what Councilman Greenlee and Cindy Bass and Councilman Tasco were saying. This is the city of brotherly love and sisterly affection. If a business doesn't want to support its workers with sisterly love and brotherly affection, we don't want that business here in Philadelphia. We don't want it. We don't want it. When you all, the council members who support this bill, are saying that you leaving certain things vague, that's because you support brotherly love and sisterly affection. And when you put specifics on those specific things, that's not showing brotherly love or sisterly affection. So we definitely support you and the way that you decide to have this bill. And if you do look at this bill in another year, look at it also on our side too. Maybe we should make the carve out a little bit lower. Make some of those things a little bit more vague to give us a little bit more freedom here. I'm a temp worker. I'm a banquet server, and I work for a staffing agency. So some of those things you're talking about, the 4 hours, I see and we see, because that's what they do anyway. Our agency is in Philadelphia, but a lot of businesses are in other counties. Okay, they'll call up the agency 11 o'clock. Can you get me a banquet server to King of Prussia by 2 to work 4 hours, 2 to 6? All right, is that really worth it for us all the time? No, it's not. So sometimes we get the brunt of them wanting to cover a short shift. So all that stuff I understand very well. But look at the other side. They're paid to cover that stuff. When they talk about, I'm short of weight, I'm short of busser, managers get paid to cover that. Because I know in the industry, so many times you see maitre d's serving tables, banquet managers serving tables. I tip at the Four Seasons. Many times the host and the hostess is out there serving tables because people call out sick. They're paid extra money because they can cover that shift. So when they cry about we need someone to cover, they're getting paid. They're getting paid for that issue. So this is an issue that's very important, and people remember it's earned sick days. We're not asking anything for free. We're earning our sick days. We're earning the right to have them. 2 very quick stories. Had a coworker who was pregnant. She tried to come to work pregnant. She got sick on the way from the agency to the job. She had to go back to the agency to wait for her husband to come pick her up. Agency never called her again. Why? Because she couldn't work that day. Never got called again. She got blacklisted because she couldn't go to work that particular day. I'm dealing with an issue right now. My father, unfortunately, left this world a little over a year ago. And there were days that I should have taken off to be with him in the hospital. I couldn't do it. Why? I'm an on-call banquet server. And when I felt sick or he was sick, I had to go to work. And my mother still constantly, almost every day of my life, tells me, Andre, if you'd have been there, I think Daddy would have still lived. I don't know that to be a fact, but she was with my father 365 for 3.5 years. And she's telling me, Dad was calling for you. Dad was calling for you. Dad wanted to see you. And I'm like, okay, Mom, I'll be there tomorrow. I'll be there the next day. Next day I'll call. I'm like, going to work. So I'm affected every day knowing that there's a possibility my dad would still be here if I could have had an earned sick day. So I'm glad this legislation is here, and I'm hoping that it's enacted, that you all vote for it. And please keep in mind, we as workers just want the same thing that all those people had that oppose it, our right to an earned sick day. Thank you.
Thank you very much. Mr. Curtis Custis.
Hello. Thank you for the opportunity to speak.
What is
to
your
you.
name?
I'm sorry, ma'am. My name is Raphael Curtis. I just want to thank you for the opportunity to speak to you today. I'm 24 years old. I work in fast food. I am here today to add yet another voice saying our city and our workers need guaranteed paid sick time. Huge fast food corporations like McDonald's make massive profits. Their top executives make thousands of dollars an hour, but workers like us make minimum wage or close to it. We're the ones out there making and serving the food, getting cuts and burns and standing on our feet for hours, but we don't make enough to survive. We have to live with relatives, skip medical care, choose between feeding ourselves and paying the electric bill. We struggle hard every day. Big McDonald's won't share their huge profits with us. So we've been organizing and speaking out and going on strike. It's not just the low pay, it's the total lack of benefits. We don't get health care. We don't even get sick days. Even though we're serving food and handling money all the time, we can't get paid for taking a day off to get better. We have to choose between keeping our germs out of the kitchen and go towards a gas bag, making a day's pay. We have to choose between resting to get better and making a little more that could go towards a gas bill or rent. For too many of us, there isn't a choice. We need to make every penny we think, we need to make every penny we can when we earn these low wages. I've seen people work sick in the kitchen because they just didn't think they could risk upsetting the managers by taking off a day. I've been really sick and had to lose a pay because I couldn't get out of bed. I heard of a fast food worker who tried to call out for a stomach bug. Her manager told her that if she didn't come in, she would be fired. She went to work and was sweating all over the food. She was running back and forth to the bathroom, and her manager told her to stop. She ended up defecating on herself. Is this what humans deserve?
That's right.
Not only is it dehumanizing, it's obviously unsanitary. This isn't right. Workers, especially food service workers, need to be able to get better and not to have to lose precious pay. We should be able to keep our germs away from customers so more people don't get sick. We should be able to stay home and take care of our children if they are sick. Paid sick leave laws have been a huge success in other cities. Philadelphia needs to catch up and make sure we have a healthy city. Thank you.
Let me just move this over to the side.
It's not on. Thank you very much.
Good afternoon, ladies and gentlemen. Good afternoon, Chair, Council, City Council. My name is James Meadows, and I'm here to testify today concerning the paid sick days as well. I've been on both sides of the fence. I'm a new business. I have a new business, and the name of my business is Advanced Small Items Movers. However, I have experienced that part of being an employee. I've worked for the restaurant business for 8 years, and I've experienced what it's like to be sick, to have to work and continue to work because you still have bills that must be paid. You still have things that you need to take care of, and for some of us, we still have loved ones that we have to take care of. I have 4 employees which respect me and I respect them. I expect the best from them. They expect the best from me. I try to give my employees the best because of the simple fact, when you do not give your employees the best, then they will not give you the best service for your customers. I believe in taking care of my customers. I believe in that customers comes first. What a lot of these businesses and even these people that has testified here today refuse to view or to listen to or to even acknowledge the fact of their foundation. Their foundation is not the corporate. Their foundation is not those that are at the top of the list. The foundation has to start at the bottom. I believe this foundation starts at the bottom with the people that works hard for them, with the people that put forth the effort to show up on time and to go through the hard, trying times of running their business and making certain that customers get the best service. Again, with being sick, it is a horrible thing to work in a restaurant or a hotel or anywhere being sick. I've experienced that. I've been sick. I've had fever. I had stomach virus. I puked. I used the bathroom frequently. I all but passed out. And if I was revived, I'd have still went to work. This is the type of conditions that we're working under. This is the type of conditions that people are under. This is the reason why stress is so high, because there's so many of us, and not just within the smaller jobs, within all jobs. Everybody should get paid sick days. It's enough that you have to go through what you have to go through, and that's just life. We have to go through life with these type of circumstances. Again, with my business, being as there is very expensive items that we move out of people's homes, that we move into people's homes. I have to be very cautious of who works for me. If I'm not cautious about who works for me, then I suffer a loss. If somebody takes something, somebody steals something, it falls on me. I want to make certain that if my employees have a paid sick day, or if they, if we have a bigger job or a larger job, I make certain they get larger money. And I let them know, you take care of me and I will take care of you. It's the same thing. I'm very small compared to a lot of the rest of these companies, Comcast and all the rest of these companies that have it, Marriott, all of them have it. These places have it. They have it to pay. When you look at figures like this, and this is coming from the U.S. Census, when you look at figures, and this is just for the 9139 area code, you have 308,942 people in that area code. Out of that, within the past month, and this is going from 2009 to 2013, there's 65,050 that are poverty-stricken in that neighborhood. This is out of those who are working. Out of the males, you have a male householder with no wife. It's 6,713. Out of a female household with no husband, it's it's a walloping 43,308 that is poverty-stricken of the females. So this is what our economy is looking like. This is below poverty level. These are people that desire to do the right thing. These are people that desire to work hard. These are people that desire to give good services, but can't, because I have to go to work sick. And if I continue to go to work sick, chances are I'm going to get sicker. Now, instead of me missing maybe 1 day or 2 days, which is what they're not realizing, I'm going to miss a whole week worth of work. Whereas if I had that one paid sick days, I could have kept my balance. So I just stopped by today basically to let everybody know that the workers, employees as well as employers, are important. But it's a shame and a disgrace when you have greedy employers. 25 cents is not a whole lot. 25 cents or an hour for 40 hours, 1 hour credit, that's not a whole lot to give. These are greedy folks. And I would appreciate it if y'all would consider that. Consider passing that bill. Consider making this a law. We depend on y'all as legislators. We depend on y'all to be the leaders. And we depend on y'all to uphold our rights. And I thank y'all so much for even considering this, council. I really do. I appreciate it. Everybody take care. That's my testimony.
Thank you. Thank you very much. We appreciate your time, taking time to come to testimony. I want to say to Mr. Butler, we don't want the businesses to leave. We want the businesses to stay. Philadelphia, we need them. But we have to find a way to work together to address the issues that come before us. So they're very vital to the city. The workers are vital to the city. So we just have to find a common ground on how we work things out. So don't throw them out. I want them to stay. Okay? Thank you. They provide services and taxes. Okay, next, our next panel. Next panel. Reverend James, I see Ms. Gim is coming, and Marianne Bellasorte. Last two witnesses, if there's anyone else, please let us know. We will, when these witnesses finish their testimony, and we will call for the vote on the bill. Okay, Ms. Gim, how you doing?
Good afternoon. Thank you very much. I'm going to be very brief because I think it's far more important that we get to the vote. Especially after listening to the testimony that comes before us, I understand that this is a political issue, and I understand that paid sick leave is an economic issue. But after listening to so much testimony, I think it's also very clear that it's a moral issue that we're dealing with, and it is time for this city to step forward into a moral future. I want to say just very quickly a few comments about what it's like for many Philadelphia families to send their children to school and to not have a paid sick leave policy. We've got hundreds of thousands of parents whose children attend the Philadelphia public schools. As we know, 39% of our city's children live in poverty, which is an absolute disgrace. We know that a huge number of them are located within our Philadelphia public schools. But what is even more distressing is that so many of them attend schools where there's not even a school nurse on staff. We know very well the consequences of a massive and dangerous shortage of nurses in our schools. We know that children in poverty are vulnerable to life-threatening situations which can come up, and often do crop up at a moment's notice, and that parents are frequently called out of work to come pick up their children from school because there are no school nurses. We have one nurse for every 1,500 students. Schools that once had nurses 5 days a week may only see them 5 days a month. And without a responsible sick leave policy, we now have families sending sick children into schools which lack the means to take care of them in any way. And when parents have no choice but to send their sick children to school, the health of other children in the building, of teachers and child care providers is also at risk. And with paid sick days, we know that parents can begin to take care of their children and for well child visits to get them the immunizations. We won't see measles outbreaks, and prevent some serious illnesses. And what we also know is that we need to choose today between a policy without paid sick leave that insists that a family member and a parent has to choose between being able to feed their child or being able to care for them. That's not the role for this city to be doing. Actually, let me be clear about that. We want our city to be making sure that parents don't have to make such choices. It's our responsibility that every worker has fair and safe working conditions. We must know that we have a major chance towards building a stronger and more sustainable economy where employers and employees share in both the responsibilities and the benefits of a prospering city. It's great to have a city full of restaurants and growing retail and hospitality sector, but trendy gastropubs and shishi hotels depend on our workers and our neighbors, their parents in our schools. Let's have a Philadelphia take a step towards a moral future and pass the paid sick leave policy. Thank you.
Thank you. Ms. Bellasorte.
Hello, good afternoon, everyone. My name is Marianne Bellasorti.
And you're going to summarize your testimony.
I certainly will, believe me. I am here representing Pathways PA. We're one of the foremost providers of residential and community-based services in the greater Philadelphia region. I'm also here representing the Coalition for Healthy Families and Workplaces, which is made up over 100 organizations supporting earned sick days. We worked very closely on this legislation. And finally, I'd like to say I'm also a member of the Mayor's Task Force on Paid Sick Days, and will echo some of what my co-members have said about having worked hard on the issue and on seeing this bill as being a good compromise with what the task force recommended. I actually today want to share very briefly a little bit of my own story on the need for earned sick days. Last April, as I was entering the third trimester of a healthy pregnancy, I was very suddenly diagnosed with stage 4 inflammatory breast cancer. My doctor, not surprisingly, recommended immediate action. In the course of a week, I ran through every test the hospital had to offer me. I had surgery, I had my first chemotherapy treatment, and I had absolutely no time to think about work. And I'm pleased to say that I had earned sick days, so I didn't have to think about it during that time. Without access to earned sick days, I would have put off the appointment that led to my diagnosis. I know that I couldn't have afforded to take the time off for chemotherapy or surgery or radiation, and those were all things that I had to do. And the need for earned sick days didn't end with me. Paid time off meant that I never had chemotherapy without a family member by my side. It meant that I wasn't alone on the day when I actually felt my baby jump, as the doctor said, it's malignant. It meant that when chemotherapy demolished my immune system to the point where I couldn't even be around fresh flowers, I didn't have to worry about my coworkers bringing illness to the office. But because we live in a society where paid sick days is not the norm, I did have things to worry about, besides the obvious, of course. I had to worry about the cashier at the grocery store coming in sick. I had to worry about the clerk at the drugstore when I went to pick up my prescriptions. And I had to worry about the servers at any restaurant I ate at. Not one of those people would have wanted to get me sick, but every one of them would have had to come in if they had no earned sick days, because it was a choice between feeding their family or staying home. I'm very glad to sit here today and say that I am in complete remission. I have a happy, I have a very happy and healthy 7-month-old son at home, and I'm looking forward to seeing him at the end of the day. But I also have to say there are thousands of people in our city who are diagnosed with cancer who have to worry about everything I had to worry about. There are so many more who are dealing with other illnesses, with disease, and with trauma. Allowing these workers to earn sick days will change their lives for the better and will make our city a better place to live. Thank you.
We thank you so much for coming in to share your personal story. And thank you very much, and we're glad you're well. We'll keep praying for you.
Thank you.
Councilman Greenman.
Just very quickly, I just would be remiss if I didn't put on the record the tremendous work that Ms. Bellasorti did on this bill from the very beginning. I don't know how many conversations we've had, meetings. Lately, her son has been involved in them over the phone sometimes. I think sometimes I hear him say, will you get this turkey off the phone so you can pay attention to me? But she has been invaluable. There's been so many people involved in making this bill work, but hopefully when we get this bill passed, I think unofficially should be named the Marianne Bellasorti bill, because she did so much. So again, Marianne, thank you for everything you've done, and it's only about a week more and we're gonna finish the job, okay? Thank you.
Thank you.
Thank you. Is there anyone else here to testify? There being no further witnesses, I'd like to thank all of you who came today to support this bill, those who came to express your concern about the bill. We will certainly move forward to pass this bill, and then as we observe the implementation, the council is open to reviewing and making any adjustments on either side that will make it better for the employees and the business owners in the city of Philadelphia. So thank you very much. I adjourn the meeting, and we go the public hearing, and we'll go into the public meeting. I now call on. Where is she? Council member is on her way down. She wants to be on record as voting. She'll be right back. Oh, I do have the testimony of Mr. James Plum. He's a Dr. James Plum, and his testimony will be a part of the record. If you want to see it, it will be in the clerk's office with the bill.
No, thank you. Thank you.
We're all right with it. While we're waiting for our council member, we have some amendments that will be proposed by Councilman Greenlee.
Thank you, Madam Chair. I just want to just state that those amendments were worked in conjunction with both the advocates and the administration. And should I move forward now?
Here she comes.
Okay, here we go. Okay.
We now call on Councilman Greenlee to move the bill.
The amendments first.
Move
yeah.
the amendments.
Thank you, Madam. Thank you, Madam Chair. I move the adoption of the amendments to Bill number 141026.
Has been moved and seconded that the amendments be adopted on Bill 141026. All in favor?
Aye.
Is there any opposition? There being none, the amendments are adopted. Call on Councilman Greenlee to vote to
Move the bill.
move the bill out of committee.
Gladly, Madam Chair. I move that Bill number 141026, as amended, be reported out as committee with favorable recommendation, and that the rules of council be suspended to allow for first reading at our next session of council.
It has been moved and seconded that Bill 141026 be moved out of committee with a favorable, as amended, be moved out of council with a favorable recommendation, and that the rules of council be suspended. So this bill will be heard at council's next session. All in favor will say aye.
Aye.
Is there any opposition? There being none, the motion is passed, and we thank you all. Thank you. Thank you.